Overview of the situation of children in Uganda. Uganda has a relatively young population with more than half of all the citizens, that is around 56%, under the age of 18 years. The age dynamics in Uganda provide a potential resource base for future demographic dividends, if properly harnessed by government. Indeed, over the next 2 decades, today's children hold the potential to transform Uganda's economy while remodeling the socio-economic future of our nation. Over the past 3 decades, the government of Uganda enacted an array of policies that have substantially improved educational attainment and health outcomes among children and adolescents in Uganda, while reducing the monetary poverty by more than half. Unfortunately, many of those gains were slowed and in some cases rolled back. In the wake of the COVID-19 pandemic, literacy levels in lower primary, for instance, worsened during the COVID closures. We know we closed for 2 years and more. While reported pregnancies among girls between 10 and 19 increased, in some cases, in some areas, drastically above their pre-pandemic averages. The issue of teenage pregnancy has been of special concern to UNICEF, given its status as an important Indeed, 18% of annual births in Uganda are a result of teenage pregnancies, while nearly 1/2 of all maternal deaths are in adolescent girls. On the poverty front, the government of Uganda has made remarkable progress in its quest to eradicate monetary poverty. Indeed, between 1992 and 2020, the proportion of the population living in monetary poverty fell drastically from 56% to 20%. However, serious challenges persist, especially in as far as children are concerned. COVID-19 drove 2 million Ugandans into monetary poverty. Yes? Between 2020 and 2021, while rates of multidimensional poverty have remained high, which can hinder access to healthcare, education, safe drinking water, inadequate clothing, regular meals, and shelter that is not overcrowded or squalid. Before the pandemic in 2020, an assessment of the multidimensional poverty that was undertaken by UNICEF suggested that under half of all Ugandan households, 47% experience multidimensional poverty, while 56% of children below 18 experience some of the highest rates of multidimensional poverty throughout the country. That is, COVID-19 likely worsened those statistics, although we currently do not know to what extent. I think things have gone worse since we have completed COVID and now entered into another phase of Ebola. Children across Uganda are struggling with these and other challenges, including FGM, cultural excesses, domestic violence, and child abuse, which will require targeted investments above and beyond the current financial year 2021-2022 budget. Yet, marshalling these investments will mean having difficult discussions about trade-offs, especially given the current global economic context characterized by inflationary pressures at home and in donor countries. It's so worse that when we have all these problems, again we have a global economic downturn. Energy crises, political instability in Europe, and ongoing humanitarian emergencies in different pockets of the world, including the Horn of Africa, which is adversely affecting Karamoja. What will such dynamics mean for children in Uganda in the months to come? What are the costs of inaction? If we did nothing, what will happen? Which are the greatest priorities for the government given the limited resources? These are the larger questions that a dialogue series about children can raise, while providing government experts, practitioners and researchers with space to engage each other about the priorities, opportunities, and support needed to ensure that children have access to the kinds of inclusive and sustainable opportunities that can reap dividends in the years to come. I'm happy that the theme for today is recovering the lost gains for children in 2023-2024 budget cycle. I thank you, and thanks for listening to me.
Thank you very much, Honorable Chibidige Sebonya.
Just a moment, I just want to say that I'm Kasura Robert Sebonya, much as I also welcome the name Chibidige, but I'm the head of the delivery unit here, and I'm not alone. I'm supported by Alice Doyer, the head of the education thematic areas, the team leader. I'm also supported by Mr. Tebenkana, expert education. I have Madame Honorable Rose Mbabali. She's also our head of the public sector, thematic area team leader. I have Engineer Kongisha, and I have the one and only who has organized this symposium and engagement, Dr. Julius Okero. More claps for Okero. We have put this symposium together. And we shall also be addressed by Dr. Inid, part of our team in the delivery unit. Dr. Inid, please, you better introduce yourself before you are called upon. Just stand up. Dr. Inid shall be part of the expert representatives. I thank you.
Thank you very much, Honorable Sebonya, for that. And I think you mentioned one key aspect that we also had tackled, that nearly half of the maternal deaths are reported in adolescent girls. This could emanate from them just skipping to go for the antenatal, or because even when they go, they are mistreated and never want to come through, so there are lots of complications that do come through. But also the fact that they're still young and their biology may not accept them to bear children, the easier way, issues with pre-eclampsia coming in, and they do not know just how to be able to run around it. So there is just a lot about having to deal with children. And I love that Honorable asked the cost of inaction. I want each and every one of us to just think, if we did nothing and paid a deaf ear and acted blind, that nothing is happening and we're not listening to anything, what would the future hold for us? That is a question to ponder upon. And without any further ado, ladies and gentlemen, I would like to, still looking at the situation of children in Uganda, get a particular presentation report from Mr. Tawanda Chinembiri, who is the Social Policy Manager at UNICEF, who is going to give us a much broader perspective of the current situation of children. And I know that UNICEF has also done quite a lot of research, and also not just research to find out what the problem is, but suggested a number of recommendations to how some particular issues can be dealt with regard to the situation of children. So ladies and gentlemen, with a round of applause, allow me welcome Mr. Tawanda Chinembiri to give us an overview of what UNICEF has found out as the situation of children.
Good morning, colleagues, ladies and gentlemen. Thank you very much for gracing this occasion. I'm going to be making a very, very high-level presentation. It's not really going to get into a lot of details in terms of what we see as the perspectives of what's really happening with regards to children. But I know that our high table are, sitting facing the other side. But please feel free, to join the first row so that you're also able to, to follow the presentation. I'm also told that the chief guest will also be coming in shortly as well so that they can follow the presentation. But please feel free to join the front seats for now. So thank you very much again. So my name is Tawanda Chinembiri. As introduced, I'm with UNICEF, making this very short presentation. So the essence of this presentation is basically just to try and give a little bit of some context and some insights in terms of what we see as the situation of children, in Uganda. So that this is just as a precursor to, I think, the detailed discussions and exchanges that are going to be led by our panelists as soon as the presentations are done. So thank you very much. So, look, I mean, when we talk about children, today I will try to really speak like a child, because I believe I'm a child. I belong to someone. I have a mother and a father, and to me, whether I'm 10 years, I'm 15, I'm 20 years, I still remain as their child. So I'll continue speaking like that. Us as children, we as children, please forgive me for using that language. But I think, the very first thing that we need to, we also think about as we're talking about children is that you can't really divorce children from the economy. Whatever is happening to the economy has an impact on children. When the economy is growing, when the GDP is growing, the GNP is growing, it also impacts on children. So we also need to situate the children within the context of what's really happening within the economy. I will not spend time here, but basically, showing that the economy, as the economy was growing, I think for the bulk, of the years, we see that the economy was growing, the Ugandan economy was, was growing, right? This presentation, this slide basically shows that one, the economy has been growing, but has it really been sufficiently growing enough to really be able to impact on outcomes for children? So the first, graph that you see on the left here basically shows what's really happening in terms of some of the sectors that have really been growing so well. And when you look at this, the services sector, for Uganda has really been growing so well. And this is really quite good. You're looking at about 44% on an annual basis for the year 2021. But the question that always comes in is when you see these growth numbers, what exactly do they mean in terms of the quality of the service or the services that are basically growing so fast? So mostly you realize that this is like a very small petty trade, border writing, and those kinds of things which are basically growing this fast. And is that sufficient enough to really be able to uplift the children from the situation where they are, their access to health services, their access to education, water, and so on, can really be guaranteed? It might not be because of the quality of those services. To the right, I think it's just a graph that basically shows in terms of the structure of the Ugandan economy that mostly when you compare, normally I'm always very skeptical about trying to compare between countries, because sometimes it might actually be beneficial for you to compare yourself against yourself. Because sometimes we can be very comfortable that we are doing better than the next person, but are we satisfied that this is where we are and this is where we should be? Sometimes it doesn't really quite help. We might need to look at it more. But when you look at where Uganda is, the level of informality is also a bit high. And that also has implications, for example, in terms of sustainability of any interventions that may be required to really be able to develop and support outcomes for children of Uganda. I think the previous speaker, Honorable, basically talked about the issue around inflationary pressures that we're actually beginning to see, not only in Uganda but all over. And I think the biggest challenge that we're actually seeing in this case is mainly, with regards to, to food inflation, which is really peaking quite a lot. And I think at this point in time, yes, we've seen a tipping in terms of fuel, but food inflation is actually, quite high. And I think when we're trying to look then within the food basket, which are the commodities, I think at some point it was tomatoes that also, that were quite high. Maize, fresh beans as well, were also, showing that there was huge increases in terms of the prices. But that's really something that's of concern, because that the fact that we're really basically getting to a situation where food inflation is so high. Health, for some reason, I think, there is a bit of some stabilization in terms of the, inflation there. Right? But now, when we look at this situation, we also want to draw ourselves a little bit closer to how, for example, things are happening with regards to the resources that are being spent. So we just try to look briefly in terms of the spending within the current year, what exactly is happening on a broader, on a broader scale. And I think we have seen, I think, a bit of some challenges since the beginning of the year in terms of, negative fiscal balances. We're actually basically at this point in time spending much more than actually, is being collected. So when you look at the graph, at the bottom, the red-orange line is basically showing the revenue, and then the one that's fluctuating is showing the changes in the expenditures. And what we are seeing is that when you look at the monthly, so this is basically information that's coming from the Ministry of Finance monthly reports, is basically showing that the revenues that are being collected on a monthly basis, they're largely flat. Nothing much is changing. But when you look at the expenditures, that are being incurred, they're actually much, much higher, which means we're basically, incurring, some deficits because our revenues are basically less than the expenditures, except for the month of September. But, the situation could have been worse for the previous months. The reason why, for example, we are actually having that biggest deficit in October is because there were lots of expenditures that could have been incurred in the previous month since the beginning of the year that were then pushed into October. So that's why we have a huge bulge in expenditures against, more or less a constant amount of, revenues that are being collected. Why are we saying this? Is because we really, I think, as children, also don't want to make very unrealistic demands without really looking at how we fit within the broader economy. So we're just, highlighting this so that, I think we are all on the same page. Now, this is in terms of the number of poor people. I know that Uganda has really made a lot of progress with regards to poverty reduction in proportion terms, right? So when you look at the percentage, it's actually, going down. But because our population is also growing, when you look at the absolute numbers, of people that are actually poor, it has basically been kind of steadily increasing because the rate at which the population is increasing is also much, much higher. When you look at this information, I think the previous speaker also mentioned something about the impact of COVID. So this is information from UBOS, which also showed that there was an impact in terms of the, the poverty, prevalence for, for the country in Uganda. Now, I'm also just going to speak briefly about this, which is the broader aspect in terms of, what is really happening on the population, because a lot of, some of the, I think, decline in progress is basically issues that have to do with the population. So the first graph, basically we just try to put two graphs that are showing, population estimates. So depending on who did the population estimates. So we have population from UBOS and UN in terms of the projected population growth. Basically, population growing at about 3.1%, mainly being driven by high fertility rate. 5.1 is high, fertility rate, for a country like Uganda. This has been mentioned before. Uganda is basically a very youthful population. So as we are planning, as we are making decisions, we are making decisions for more than half of the population, because more than 56% of the population is below 18 years. So that's also something that's really critical. But if we are to talk about the potential for a demographic dividend, we are looking at something that should be that graph, which is on the right there. But our population structure is a little bit different. So what we actually have is a huge dependency ratio, because there is less working people that are supporting a huge youthful population as well. Right, now just getting into a little bit of some specifics. And like I said, these are basically high level, and I think the panelists will also be able to unpack in terms of some of the nitty-gritties of what basically the situation is and what needs to be, to be done. I've spoken about the decline in population proportion, in the proportion of poor people over the years, about 20.3%, down from about 37% in 2000 and 2003. The previous speaker also mentioned something about multidimensional poverty, because that is monetary poverty. But what is actually, emerging right now is that I think this is, information that is coming, that multidimensional poverty might also be decreasing to about 44% from the 56%. But this is something that is still being worked on, and I think, the final numbers will basically confirm. But that is really, I think, quite positive in many different ways, because When you talk about multidimensional poverty, you're talking about deprivations in many different areas that include health, education, and so on. And I think the information that is coming is showing that there might be a decline in multidimensional child poverty. Now, when you talk about children, children are part of a life continuum where there are different vulnerabilities that that they face. And there are quite a number of them. So besides the many shocks that exist, issues that have to do with disability, we also have a lot of challenges that, for example, children face within the pregnancy or early stage, as well as the school age. And I think in terms of the interventions, when you look at the structure of Uganda, especially in terms of the social protection interventions, beyond the direct support that is basically coming within the UP and USC grants, there is really not much that is happening in terms of direct support to some of those children, especially the pregnancy and early childhood stage. So that's also one of the key things and key vulnerabilities that children during that age may actually be facing quite a number of vulnerabilities, illness at that early age that might also need to be tackled on. But maybe more needs to be done around that area. Now, just going a little bit into the specifics in terms of health. What is the situation? I think we still have a lot of children dying under 5 annually, about 46,000. And from what we hear from our colleagues in health, this is extremely high. I don't know whether it's me or other colleagues as well. Each time that I pass through, for example, Mulago just opposite, where they sell coffins and so on, that moment when I see a very small coffin that is made, to be used to bury a baby, I get traumatized because I feel strongly that that should not happen. And I think every other effort needs to be taken to avoid that, because the moment that that coffin is there, some other child somewhere is going to be carried and buried in that coffin. And I think it's something that also needs to, to be looked at in terms of what are the key things, what are the key drivers, what are the challenges. I think we've also had I think Uganda is one of the countries that really managed to do well in terms of maintaining, vaccination even during COVID. But I think there's a little bit of a decline, especially with regards to GTP, which declined. And I think it shouldn't be the case. We have to keep this very, as high as possible. Maternal mortality rates, 349 women per 1,000. No woman should die giving birth. Giving birth is not, personal duty, but I feel strongly that this is national duty. When you give birth to a child, you're giving birth to a resource that will really be able to take the country going forward. And we shouldn't get to a point where, during that process, when a woman is giving birth, they actually lose their own lives. In the event, for example, that the child is able, to survive that process as well, there are so many other challenges, shocks and deprivations that the child is likely to face in future. They also have a right to have their own parent. But some of the causes and reasons why we still have mothers, dying in the process of giving birth is something that could really perhaps, be done. Something could be done about it. The situation could be managed, and we could actually even try to reduce, these rates so that we save our mothers, our sisters, and so on. Children on ARVs, 68%. The target would really be 90, 90, 90 in terms of coverage. But if you're still below that level of coverage, it means there are still a lot of children that should actually, be getting services that are actually not even getting, not be getting them. So it's also one of the key things that we also need to look at as we're talking about children, how we're going to be supporting, how do our future plans, how do our next, resource plans also relate to this situation. So it will also be critical. 39% of under 6 not exclusively breastfed. I think men and women alike, I think there's really been a lot of awareness that has been raised with regards to the benefits of exclusive breastfeeding within the first 6 months. But we still have a challenge. More than half, it's slightly, this is 39% not fed. So this is actually something that we need to, to also look at in terms of how do we improve, what sort of investments would be necessary, because once you do this, you're actually putting a child through exclusive breastfeeding on a better footing for them to be able to develop better mentally, which means there's a problem there with regards to nutrition. 1 in 3 children is stunted, 29% stunting rate. Chronic food insecurity in some parts of the country. So those are some of the, challenges that we're talking about. 46% of health facilities without wash services. When speaking to those colleagues in health, I'm pretty sure that we also have colleagues in health in this room that will be able to explain to you how important water it is in a health facility. in terms of, infection prevention and so on. And I think when you have a situation where less than half of health facilities have proper wash facilities that will be able to help, with regards to provision of clean water, that's a huge challenge. What is the problem? And then now when you try to look, for example, on the other side, when you look at the neonatal, it must be the neonatal rates, right? It's actually not improving. And much of the, I think, the discussion that is happening is that a lot of it perhaps also has to do with, infection control within health facilities, that children get to pick some of these within the health facilities, mostly attributed to issues that have to do with lack of wash facilities. Now, now just trying to speak briefly in terms of the situation, because now we're talking about health, because human resources for health is a very critical ingredient. We might have as many, medicines as possible, as many facilities as possible, but the challenge always comes in with regards to the issues that have to do with human resources for health. And here I just want to draw your attention to health center tools, because that's where there's a bit of a problem with regards to availability of staff. There's a challenge there. And health center tools are a critical part of the primary health care delivery. And if we don't have, for example, adequate staffing at that level, that is actually a little bit of a challenge in terms of how, services are actually, being provided, being provided. So when you look at the graph below, in terms of the head count, it's also actually very, very high in terms of posts that are actually unfilled. So that's one of the key challenges. Now, but at some point, what was also interesting is that when I looked at because this is 2020 data in terms of staffing at the Ministry of Health headquarters as well as the regional referral hospitals, there was a time, I think this must be 2017-18, when at the Ministry of Health there was actually overstaffing. But during the same time, you actually had a problem with regards to health center to staffing situation. So the staffing situation is critical for primary healthcare delivery. When it comes to, I think we also have this slide which is talking about malnutrition, one big problem. And I think what we're trying to do there is to put a bit of some information with regards to the malnutrition situation. 19% increase in the number of children admitted in health facilities nationwide to be treated for severe acute malnutrition. So 1 in 5, right, increase in the number of children being treated for severe acute malnutrition. I think this is something that perhaps in Uganda we really have to look at quite seriously. I know that the panelists will also be able to touch on some of the challenges that are related to nutrition in Uganda. And one of the key things that perhaps we need to do in terms of trying to resolve that situation. 10% increase in newborn deaths nationwide in 21-22 compared to 2020-21. So newborn deaths increased at least up to now, 2021-22, 10% increase in newborn deaths in that financial year. So we continue losing children. And the rate of the increase is actually quite high, because 10% increase in deaths of newborn is not a joke. While we are saying no child should die, this is something that is actually happening during our lifetime. Right. Talking about education, a bit of some efficiency issues that perhaps need to be looked at. I'm looking at my colleague Nabendra here. I know he always speaks quite passionately, with regards to issues that have, to do with education. So when you look at, in terms of the percentage of children aged 8 who could not read, look at the increase. Between 2018, there was only just 1 in 3, but now half of children below the age of 8 actually have problems with reading. So that's quite a big challenge. Where are those children going? And then from here, going forward, what are we going to do? What kind of society are we actually building in this case? So I think it's also one of the things that we also need to to look at, I think, quite critically. Only 32% complete primary education in 7 years. Perhaps some take more. Some of them might not even finish. Transition from primary to secondary still remains quite low, 69%. So this is like 2 in 3 where do the rest go? Where do the rest end up? What kind of citizens are they going to become? Because when they only just complete, there is a lot of loss that has already happened at primary level, but then transition into secondary is also quite low. 2 in 3, in every 3, only transition to secondary. The net enrollment rates, I think I will not spend a lot of time around that. Widening disparities in terms of pre-primary attendance, Karamoja 38%, and then about 38%, and then it's actually even lower for Karamoja, about 16%. So less than 1 in 5 children in Karamoja actually attend pre-primary. Primary attendance ratio, also quite low in places like Karamoja, 88% in Kampala, so those disparities geographically. So what we need to do is we're actually making our efforts to be able to support in terms of primary attendance or issues that have to do with pre-primary. We also have to be much more focused in terms of the areas that we need to look at. Only 9% of children with disabilities enrolling in primary, and only 6% finish. There is a bit of a challenge there that we also need to look at quite critically, because once there's a lot of leakage in terms of these children, already they are facing a lot of challenges in terms of access to education. But then, if they start and then they also then don't finish, that's also a little bit of a bit of a challenge that needs to be looked at. School financing remains quite a big challenge. For Uganda, I think we also have a challenge with regards to the per capita allocations. Are they adequate to really be able to support schools to be able to provide the best quality of education? Maybe there's also a little bit of a challenge. Huge classrooms, they're also a big issue, which is something that perhaps has to do with the number of schools that are available, but also the number of teachers as well that are available to be providing that services. In terms of movement of the curriculum, I know that there are reforms. My colleague Nabinda would speak better about this in terms of trying to modernize the curriculum. I think it's also one of the areas that perhaps needs to be looked at in terms of trying to ensure that it also takes into account some of the key targets in terms of modernization of education in the country. I want to speak there about two or three graphs, especially in terms of what is happening in education. So what we did in this graph is trying to look at the data, official data around the enrollment rates in education. Which children, how many children are in school, and so on and so forth. In this case, we're talking about the gross enrollment rate. We then tried to put together the population estimates, the population projections from the 2012 census going up to 2030. And then we tried to look at each and every age category to see how many children are within this age category and at what level, if they are supposed to be in school, should they be. So when you look at those numbers, that are potentially from the population supposed to be in school, I think it's up to about 18 years. This is what is showing in the green line, right? And then the blue line is showing those children that are actually enrolled in school. So what that is showing is that before we even start talking about those children that are in school and whether they are completing, there are already a huge number of children that are actually structurally out of school. So this is official population in terms of those children that are supposed to be, of school-going age, and then those that are actually in school. There's a huge difference already, and that's really quite huge, because in terms of the population statistics, there's about 20 million, yet there are just about 11 million that are basically in school at that for 2022. So structurally, I think there's something that we also need to look at quite critically there, because this is a problem. If we come back to ECD, because this is one of the main areas that also needs to be looked at. So in this case, this is with regards to attendance to preschool, pre-primary school. Also a huge challenge, because when you look at those officially the figures that are available with regards to the children that are attending pre-primary, and those that should be in pre-primary, structurally a lot of children are basically left out. So even as we are focusing on the challenge of those that are in school, to retain them, ensure that they learn and they're able to develop, there's a lot of exclusion. And what we need to do as a strategy is to devise how we can actually be able to get those children structurally left out of school, for whatever reasons, to actually be getting to school. This one, is talking about, secondary, same problem again. When you look at the numbers that are enrolled, gross enrollment ratio, and those children of school-going age, huge challenge with regards to structural, exclusion of children from school. We have a bit of some issues with regards to protecting the rights of children as well. Birth registration, I think this still remains a huge challenge. And this doesn't only, pertain to children, but I think there are also other issues that have to do with national registration and the reforms that NIRA is doing, what NIRA is trying to do to roll out the national registration. But when a child does not have access to a birth certificate, there are so many other things that perhaps they will not really be able to have access to. 1 in 4 of 15 to 19-year-old have begun childbearing. I think we've spoken about issues to do with teenage pregnancy. I know this will be discussed perhaps further within the panel, but I think the previous speakers also, including the facilitator, mentioned issues that have to do with teenage pregnancy. Huge challenge. And I must say that when you look at the data going backwards, it's not an issue that only came because of COVID. There's always been a problem of teenage pregnancy in the country. And I think what is necessary is perhaps COVID really brought this more attention for people to discuss openly about it, and perhaps also start thinking about what perhaps needs to be done, about this issue. There's the problem around children, street children as well. About 16 children coming to Kampala streets every day. This is data, I think, from our own colleagues in child protection. So that's also, I think, one of the other challenges that we need to also be trying to look at. So this is what children basically find themselves in terms of the situation. Gender-based violence was already high before COVID. Before COVID, and it still remains quite high. So when you look at the data that is coming from the health facilities, it's showing that, of course, there might have been a decline between 2015 and 2019, but it's still very, very high in terms of the gender-based violence cases. And when you try to look at those that impact on children, we basically try to look at 3 things. 1, defilement. I think we have domestic violence and child neglect. We have a problem with regards to defilement cases. This is a huge challenge. It's so this is data from the police report, the annual reports. This is a huge challenge. Especially, for, in 2015, yes, there might have been a decline, but generally over the years, when you look at the number of cases reported, defilement is a big issue. And much of this basically involves children. And a lot of effort perhaps needs to be done for us to be able to protect those children from, from some of these cases. Climate change, I think we have seen quite a number of things. These are shocks that, sometimes come through with the locusts, issues of floods, with the problems around malnutrition, as some of the challenges that are also coming because the droughts also impact in terms of food security. So it's also, I think, some of the things that are that children today are basically facing. And I think as we're actually planning, we also need to be looking at this quite closely and say, how do we build resilience so that our children can actually be able to enjoy their rights in this case. This is just a snapshot in terms of what we've been doing. So I've now just taken a slide that is showing in terms of the financing situation, that when you look at access to health, this is just as a typical example. We basically remain flat in terms of the amount. Yes, there's been a bit of an increase in terms of amount of money that is being allocated to health. But in proportion terms, this has basically remained very, very constant at just about 7 point something %. There's really not been a huge challenge. And what we are saying there when we're calculating those proportions is basically that we are taking into account the entire resource envelope. I know that the percentages will be different if somebody only looks at the discretionary allocations, but that's also, I think, one of the key challenges. And I think it really takes Uganda in a very interesting situation where I think if you compare to other countries within the region, I think this data is for 2020-21. We're actually quite low. And then when we try to look then, because what is of importance, especially for health, is the primary healthcare system. Because no matter how much you invest in health, at whatever level, if your primary healthcare system is not functioning, forget about reaping the gains. You will still be seeing queues and queues in Mulago, in Naguru, in all the referral hospitals, if your health center 2s, health center 3s are not working. So what we try to do here is that, trying to look at the budget call circular issued by the Minister of Finance this year, we're actually seeing a big challenge with regards to primary healthcare financing. There is actually a projected decline if the figures that are included in the budget call circular were to be approved today, because there is a huge decline in terms of the amount of money that is going to districts for spending within the primary healthcare system. And I think the graph to the left there is showing some of the districts And I think the cuts will actually be very serious in Mitoma district. 61% decline in health budget for Mitoma district. I don't know what is informing this, but I think this is one of the key things that are really, really, I think, concerning for us, because we also need to be, I think, looking at this very closely. I think we have a full report that we can share with colleagues that basically talks about, talks about this. So in terms of the districts, I think a total of about 117 districts and municipalities are actually projected for declines in their primary healthcare budget. So it's 117 because the vote system also, some districts have municipalities and rural districts. So when you split them, there are about 176 votes that pertain to primary healthcare system. 117 of those districts and municipalities are projected for declines. And when you go further to look at that situation, you actually realize that those primary healthcare facilities that are owned by the government are the ones where those declines are actually projected. So the private not-for-profit, so those that are owned by churches, there's kind of maintaining of the status with regards to financing for health. But that's really concerning. I think it's something that we need to be discussing much more as we're actually looking at discussing the framework paper with the parliamentarians here, that we look closely and see how we can actually be able to preserve, at least for primary health care, because that's really quite important. Education, also I think in terms of the total allocation, just about 8.6%, Uganda lagging quite behind. But I think what is also important in this case is we also try to look at the core secular again, to look at what is happening in terms of allocations to districts, education districts. So we also have some districts that are actually registering as much as almost 1%. Education is not really much, but there's quite a number of districts where declines are actually projected for, for financing for education. But in this case, in this situation where I think the classrooms have become bigger, especially for the first grades and early grades, because of the 2 years, that we're actually behind. We should actually be seeing, I think, much more basically going towards supporting education at that level. But if we are seeing declines, I think that should also be something that has to concern us. So there's also a report, I will not get too much into the details around, around this as well. Then I think just to try and sum up in terms of some of the things that we need to look at. From our perspective, if we are going to be able to have a population that is healthy, children that are going to, to grow well and reduce the burden of diseases later in their lives, we need to make a lot of investments in primary healthcare system. One, we're going to prevent a lot of things. We're going to be able to reduce congestion, for example, at higher levels of, health facilities, but also because these facilities are closer to the communities, they are actually able to provide better services than if the same communities were to go to a higher level to access, access these services. So I think that issue around investing in primary healthcare would definitely be important. There is the issue around the social service workforce within the communities. I perhaps would anticipate that this will also be discussed within the panels. That we have social workers that are employed by the government, but one, they are not enough. These are the people that are responsible for tracing the cases within the community, the defilement cases. How do you resolve those issues? How do you identify GBV cases? How do you resolve them? And how do you support the victims? But I think there is a huge issue that is happening with regards to, one, the numbers, but also the capacity of those people. And I remember, attending a certain discussion, I think some 3-4 months ago, where there was basically, I think, a certain case where the alleged perpetrator was actually taking responsibility for going to pick the police to investigate a case where they are the subject of investigation. Can you imagine what could happen, in that situation? So I think there is also that issue around the sourcing of that, at that level. Bottlenecks in the education system could also be, avoided, I think, if we invest more in ECD and ECE, because we're going to have children, perhaps, that will go to school when they're ready. You avoid repetition, you can also potentially avoid the big classes as well. So that's something that is also a bit of something that we might also need to look at. There's the issue around malnutrition and stunting, which is a challenge. If you remember, 1 in 3 children is actually stunted. And I think if we're able to, do something around stunting, in Uganda, I think we'll be able to, avoid a lot of challenges, because a child who is stunted cannot develop better physically, mentally. And their potential to be able to be useful citizens in future can actually be reduced because they really didn't have a strong, upbringing in their early ages. So This is what I have for now. I hope this was useful. Just as a high level, I think, summary of what we see as the situation of children. So thank you very much. Hand back to the facilitator.
Thank you very much, Tawanda, for giving us that very, very insightful report. And if you did miss out on any things that are coming through, I saw something that was highlighted, 16 new children coming to Kampala streets every day. I ask, where are they coming from? Who is bringing them? What are the push and the pull factors? Because if we're talking about street children, there are always the pull factors and the push factors as well. Those are key aspects that we need to be looking at. And if we go ahead to look at 46,000 children under the age of 5 dying annually due to preventable diseases, it's absurd. Because if they're preventable, that means they can actually be dealt with and these lives can be saved. And I think, Tawanda, I totally agree with you. I think I share the same pain when you're going past Mulago Hospital and you see those small, tiny coffins for babies and you're thinking, okay, yes, they're looking for the next business, but that next business is the pain of a parent who is losing a child, which is very, very unfortunate. So I still go back to the questions, what are the costs of inaction? That is something that we all need to pay attention to. And without any further ado, ladies and gentlemen, allow me invite Ms. For a presentation on how we can do better for the children. I love this particular one because then we're moving from reading the book of Lamentations in the Bible to the book of Acts now, right? So we move from Lamentations to Acts, and allow me invite Madame Doya Alice, who will also be in part presenting with Dr. Enid Mbabazi on this aspect. Let's welcome Madame Alice to give us an overview of what we are planning to do better, the positive, and how we are going to be able to achieve the demographic dividend that we always seek to achieve.
Ladies and gentlemen, my name is Alice Doya. I work with the Prime Minister's Delivery Unit as head of the thematic area of education, and I'm here to specifically address myself on issues that can be handled to enable our children who lost a lot during the school closures this time round. My presentation is projected, but for slides 1 to 3 is about information. I wouldn't like to dwell on them, but what we know is that schools were closed, our children lost a lot. In Uganda, schools were close to 2 years. Government of Uganda did a lot. Government of Uganda did a lot to put a recovery plan, and we, up to now, children have not revived from the loss. We tried to do broadcasts on phones, on radios, on TVs, but because of issues of connectivity and lack of MBs by parents, some of the children missed out. There was phased comeback. P7 came back, P6 came back, P5, P4 came back, but this was not all embracing. Classes P1 to P3 did not benefit from this. They were left behind. I am considering the primary school level. Ladies and gentlemen, this is what was done in order to accelerate education, to accelerate learning, to do catch-up remedials and bridging programs. All this was done by government, and we offered special funding for development of standard operating procedures. Yes. Districts and schools were guided on the management of the spread of the infection. Education stakeholders were trained on how to comply with SOPs. Procurement and distribution of face masks to learners was done by the Ministry of Health. Developing strategies on decongesting and promoting social distancing in offices was done. There was a development of robust curriculum recovery plan and plans to manage examinations and related activities by distribution of home study materials. This was done through the Office of the RRDCs across districts, through the sub-counties and LC1s, but they were inadequate. Curriculum coverage was low. There was lack of supervision. Monitoring was not done, and looking at the level of education for the parents, they were not able to guide the children to go through and use them to bridge what they had lost. There was promotion of sanitation and ensuring safe and hygienic school environments through facelifts when we had just thought of total opening. The Minister of Education and Sports ordered a facelift of all school facilities which had been closed for close to 2 years. Some of them were deadly dilapidated. The desks had been used by communities in funerals and many parties, and they were not in schools. Mass vaccination for health workers also included teachers. There was a special way of vaccinating teachers at all levels, and we have seen provision of psychosocial support services for learners and staff, and this has done by many of our partners. I'm confident of BRAC, confident of ISA, I'm confident of STAR Education. They have done a lot to help us do this. There was support to catch up with the lost time through face-to-face when full opening was done. Provision of education resources in different formats, such as the electronic and hard copies, and measures to use in monitoring the use. Collaboration between the Ministry of Education and Sports, educational stakeholders, social partners, and parastatal bodies was done. His Excellency, the President of the Republic of Uganda, developed a coordinated communication strategy to avoid contradictions when speaking to parents, teachers, and learners. Time and again, he addressed the nation, gave us the risks, and gave us the way to protect ourselves. Use of extra lessons to make up for lost time, teaching time during the disruptions was also done, and parental support and guidance to enhance support to their children was also done. Phased return to schools, I earlier mentioned, this involved allowing few learners at school for specific periods. Primary 7 came in first for 1 month, primary 6 came in second for another month, primary 5 and 4 came in third for 1 month. Lessons were broadcast, as I earlier mentioned, and the focus was on grades that were at home other than those that had been returned back to school. However, this phased return was not all embracing, like I mentioned in the introduction. Primary 1 to 3 did not seize this opportunity. The focus was on grades that were at home other than those that had returned to school. However, this phased return was not all embracing for primary 1 to 5th grade, and it did not seize this opportunity. Lessons broadcast had challenges of interconnectivity, unstable internet, unaffordable Wi-Fi charges, and lack of ICT infrastructure. The Ugandan government adopted strategies that focused on curriculum interventions So that teaching and learning support that needed to be provided to the teacher and the learner was prioritized at the full return to schools. The provision and facilitation of both individual and group-based support, especially the vulnerable students, girls and learners with special needs regarding their studies, counseling was very important. What can we do better? We gave the hard copies of study materials. We broadcasted lessons on TVs, on radios, on phones. There was even Zoom learning for the private schools, but still the children lost. What can we do better? Can we borrow from our neighbors? Can we borrow from Kenya? In Kenya, we can borrow the 4-term model, which has enabled their learners to recover the lost time. Before the onset of COVID-19 pandemic, Kenya had a well-structured system of education. The primary and secondary school calendar ran from January to December. The terms comprised of 3 months and full learning and a month in between for breaks. The syllabi were structured to be covered in the 9 months at most. During the 1 month break, both teachers and learners would seize the opportunity to rest and refreshing before getting back to another engaging 3 months. This table shows the structured system of Kenya. Unlike Uganda, Kenya did not do automatic promotion. For us, when we fully opened, we massively promoted the learners. The learner who did 2 weeks in P1, when we opened, that learner was promoted to P2. The one who had not done any P2 was promoted to P3. That was not the case with Kenya. With Kenya, the students started where the lockdown met them. And what they did is to create a 4th term in an academic year. From the normal 3 terms in a year, they created a 4th term. And in that intervention, they had a child doing P2 work for 3 terms, and in the 4th term, I'm going to illustrate, they start P3 work. They use 2 terms in year 2 for completing P3 work. They go to the same year, they use 2 terms to do P4 work. And when they enter 3rd year, they normalize and go back to the structure of 3 terms in an academic year. And there, their children have really recovered the lost teaching time. In Uganda, we can copy. This is the illustration I was talking about. In year 1, the learner uses 3 terms, i.e. term 1 and term 2 and term 3 to study the content of primary 2, for example, and then term 4 of year 1 is used for starting primary 3 work. Then when we go to year 2, the learner uses 2 terms, term 1 and term 2, to complete the content of primary 3, then term 3 and term 4 of year 2 for starting on primary 4 work. Then in year 3, the learner uses term 1 to complete the content of primary 4, and then terms 2 to 4, that is term 2, term 3, and term 4 of year 3, are used for doing the entire primary 5 curriculum. By the end of year 3, the 3-term structure model will have normalized to the ordinary status quo, where learners will be able to do a given grade in 1 academic year of 3 terms. I propose that we take on that model. For example, our children did 2 weeks in P1 and they were promoted to P2, which means they missed on the content of P1. In P2, these children who missed P1, they are now in P3. Let them use the 4-term model, and in term 1 of P3, let them do regaining of learning. Regaining of learning is represented by RL. They regain literacy, they regain numeracy, and other basic learning areas. In term 1, they are meeting. That's the illustration. In term 1, the P3 child is meeting the P1 teacher on the selected missed topic in the primary 1 curriculum. Still in P1, This P3 child is meeting the P2 teacher in that created term X or term 4 to do revision exercises for primary 2 curriculum to regain literacy, to regain numeracy, and other learning areas. Then terms 2 and 4, 2 to 4, term 1, term 2, term 3, and 4 are used to teach the whole primary 3 curriculum. That is our illustration. This child is now in primary 3 in term 1 to regain literacy and numeracy and other learning areas. Will meet the P1 teacher, which he missed, and do selected subjects. Then also meet the P2 teacher to revise those basic areas that he requires to move efficiently and confidently to do the P3 work. We shall use term 1 for remediation, bridging and catch-up, on missed class selected content, previous class revision areas. This will be purposed for regaining literacy, numeracy, and other learning areas. I have passed through that illustration. What will be the roadmap? This will be our roadmap. We are going to engage in research on the school curriculum at all levels for selected topics in which pupils struggle and are underachieving in the classes that they are in. It will need expertise from NCDC, from PMDU, from Ministry of Education, from Ministry of Education and Sports, from Ministry of Health, from other agencies like DES and UNEP, and we shall need the NAPI results. These children lost out and did PLE in 2021, and we called it PLE 2020. We would like to research and see, after the loss and the closure for close to 2 years, when these children did the PLE 2020, what are those areas where they struggled? What are those areas where they underachieved? We shall use even the NAPE results. NAPE goes on to identify the subjects and the topics and the concepts that were not well done in PLE. We shall look at those. Then we do a sample of 500 schools around the nation. We shall do 150 best performing schools, 150 middle rated schools, 100 schools from remote areas, 100 private schools, and we use our friends, the users, the consumers of education, to tell us how much they are struggling, to tell us where the issues are, even to advise us what they feel we can do better to make them go back to the way. This mode will help the learners move forward efficiently with the revised curriculum. Government will be enabled to solve the automatic promotion crisis, where a child who was in the P1 for 1 week is now in P3, missed the entire P1. The education system will normalize at given levels in the long run, and this model will serve as a disaster reference in the future in case we get another problem. Monitoring. The use of monitoring of learners to assess their progress and subsequent facilitation of the appropriate intervention continues to be undertaken as and when needed. On an administrative approach, this will lead to the adoption of new educational policies and regulations such as adjustment of the academic timetable, use of new teaching programs, model of delivery, promotion of catch-up programs within the curriculum, maintain health and safety measures, and use of financial relief packages by government from the Ministry of Education and Sports. Empowerment. My request to UNICEF is that they enable the formidable team of PMDU to catalyze the recovery of lost time through this intervention. All the above will be attained very well if PMDU-OPM is placed in the lead of steering the above proposal. For God and my country.
And ladies and gentlemen, as Dr. Enid comes through, as the presentation did come through from Madame Alice Doyer, we were joined by our chief guest, who is also the Right Honourable Minister for General Duties under the Office of the Prime Minister, Right Honourable Justin Mumba, who will just stand and wave to us. Thank you so much, ma'am, for sparing time off your very busy schedule to come to us as we speak about children. And we were reminded that each one of us here is a child, because you have a parent somewhere. Yes, each one of us has a parent, and your mom or dad refers to you as my child. It doesn't matter what age you are. So we, as you came in, Right Honourable, we were looking at a presentation on how we can do better for the children in Uganda after realizing the very many problems that are existent. And allow me invite Dr. Enid to come and conclude this before we go to our panel discussion.
Thank you very much, moderator. Honorable ministers, members of parliament, the country manager UNICEF, and UNICEF staff, my colleagues, staff of the OPM, ladies and gentlemen, good afternoon. My name is Enid Mbabazi, as already introduced, and I head the thematic team of health in the Prime Minister's Delivery Unit. And this is going to be the outline of my presentation. We are going to talk about how prepared and resilient our health care system is, just to bring us, to put us into context with regard to today's theme. We shall look at the key related challenges that are associated with the COVID-19 pandemic, the direct and indirect effects of the COVID-19 pandemic on children, and we shall also reflect on what does recovery post-COVID look like. Do we want to go back to the previous state? Are we better? And then lastly, we shall look at the proposed actions. Next slide. Next slide, please. Okay, so just to give us a brief background, there are a number of challenges within the health sector, and the previous speakers alluded to some of these. Uganda has a rapidly growing non-communicable disease burden. Although there's been a reduction in maternal and child health over the years, the communicable and nutritional conditions of our citizens has not improved much, and we still have a burden of these communicable diseases, and also the problem of persistent endemic infections such as malaria and respiratory diseases that really affect our children. And here I'm referring to the young ones, not us, the old ones. We have issues of emerging and re-emerging diseases and epidemics, and right now we are battling the Ebola epidemic. We are still in the COVID-19 pandemic, although the numbers have really reduced. Next slide. Okay, I will not go into the definitions of resilience, but we know that it is a process of really being able to adapt well and bounce back quickly in times of stress. And I want us to look at how prepared and resilient our health system is. And Uganda, like many other countries in Africa, faces many complex challenges. And these are interconnected and continue to drive health outcomes. And most of them are actually beyond the health sector. And these include poverty. I think the presenter from UNICEF did allude to this. Rapid urbanization. Those of us who live in Kampala and the other emerging cities and municipalities, you know what I mean. Climate change, this is a topical issue these days. Air pollution, no need to explain this. Environmental degradation, this is a serious concern globally. Rapid population growth, somebody talked about population pyramid, which is bottom heavy. Migration and disasters, to mention but a few. With regard to our system resilience and preparedness, it is important for us to discuss this, given the frequent emergencies and the shocks to the health system that we have experienced. The COVID-19 pandemic and the current Ebola outbreak. I will not go through this contextual, conceptual framework, but we shall share this presentation for us to be able to appreciate what I'm talking about. We look at resilience. I'm sorry to really dwell on this background, but when it comes to the effects, we shall be able to put them into context. Absorptive capacity, which is basically the continuity of health services at the same level in terms of quantity, quality, and equity, despite the shocks or the stresses, using the same level of resources and capacities. And I'll be referring to the presentations to the presenters that have already spoken. He did allude to the resources that are mainly allocated to the key sectors. Adaptive capacity is adaptations to deliver the same level of healthcare services with few and or different resources. And here are examples of adaptation of delivery models in the COVID response that I can quickly remember. There was client and community-centered approaches that were implemented to mitigate the effect of COVID-19, and there was online support mechanisms to the clients and the health service providers. Most of the trainings were done online, and also other support. Transformative capacity. This is ability to transform the functions and structure of the health system to be able to respond to changing environment, or to be able to adapt to stressful situations. Leadership, innovation, creativity is key. At individual level, we need the tools, we need the protocols, and the system to be able to quickly adapt. Still on our health system resilience. We all know that we have had challenges with our system. It is not well equipped, that is a fact, to address the growing and persistent infectious disease burden. There's a lot of public outcry there, and the families spend a lot from their pockets to really access health care. Although we have progressively improved, there are still gaps in preparedness and response to health emergencies. And we saw that, we witnessed this during the peak of the COVID pandemic, whereby there was interruption in the continuity of services, of basic services. The mitigation of the socio-economic impact of COVID-19 has become very significant, and the previous speakers have alluded to this. Let's talk about the challenges that are associated with the COVID-19 pandemic, and these have really been talked about in a number of fora, including the previous presenters, so I'll not dwell on this. My colleague Alice has talked about the prolonged lockdown and closure of schools. This was really a key challenge, and we all know that schools play a useful role in promoting the importance of personal hygiene, promoting physical activity, healthy feeding, although of course the learners complain that sometimes the meals become, monotonous, but we know that portion and beans and rice are good for our children. Body feeding and body habits, as already talked about. Home captivity for children affected their physical and mental health as a result of the prolonged lockdown. And here we are looking at the consequences or the manifestation of the captivity and the effect that it had on the physical and mental health. We've seen childhood obesity on the increase, and some of you can bear me witness that your children really put on a lot of weight during lockdown, which is really not good for their health. There was reduced cardiorespiratory activity because of them being confined in the same place for a long time. Irregular sleep patterns. This was experienced particularly in children who would spend most of the time on their phones, on computers, and they would have problems with sleep. And favorable diets, because at home there's really access to some of the junk food, and which is really unhealthy. And I have already talked about the long smartphone use and the time that the children were spending on our screens. These really have negative implications on the health of these children, and studies are yet to be done to be able to identify the long-term specific health impacts. Challenges with children's physical and mental health also included frustrations. We saw many of the children get frustrated. Some parents also got frustrated and were complaining about the prolonged closure of schools. They really wanted these children back in school. There was insufficient information. We all know that a school is really one of the great avenues where our children get basic information, and with school closure, there was really an information gap, lack of in-person contact with their peers and teachers, and actually some of the children really complained a lot about missing their teachers and their peers. Lack of personal space at home. Some of this has already been alluded to. Most of us were not used to spending time with our family. There were issues with husbands and children and parents and children. And the financial burden on parents, which often is unnoticed and forsaken when the children are in school. Parents were complaining that they were spending a lot on feeding the children. They were using a lot of, there are things that I don't want to mention. Somebody said the water bills increased because of increased flushing of those places of emergency. And the complex play between psychosocial stress and the pandemic-induced homestay and lifestyle modifications, I'm very sure will further worsen the effects on a child's overall health and in a vicious cycle manner. And it's just a matter of time we'll be seeing all this. There's increased violence against children. This has already been alluded to. Child abuse, child neglect, domestic violence, teenage promiscuity. Can imagine, these schools, by the way, are considered as safe places for children, but when they're out there at home and they're doing errands, they meet lots of people, from different backgrounds, and some of them end up being abused. For instance, girl children who go to fetch water, especially in rural areas where water is very scarce, and there are long waiting lines, they end up engaging in relationships. And sometimes they are actually taken advantage of by older men. Dropout from formal education has already been talked about. Indulgence in high-risk activities. You'll agree with me when you move in the evening along Kampala streets, you see these little children vending. And actually, some of them have refused to go back to school because they are looking at the short-term, the low-hanging fruit, the little money that they are getting from vending. But that kind of activity is really not safe for these children. We've seen the proliferation of child labor. Some of them have actually, quite a number have dropped out of school, and they are engaged in child labor. So both direct and passive exposure of the children to abuse, psychological aggression, and physical punishment by caregivers leave permanent wounds in the form of impaired development of the brain and psyche, high rates of psychosomatic and these are technical terms, neuropsychiatric disorders, multiple substance abuse, and suicide thoughts. I actually wanted to raise this issue. We have young girls who have come to give their testimonies, and thanks to the organizers of this dialogue, but I've not seen the boys. The boys were equally affected, and we need to hear testimonies from them. Special groups who include the poor, like the children living in slum areas, the refugees in refugee settlements, migrants, and internally displaced children. These are very special because of their vulnerability. They are deprived, and they have deprived and endangered childhood health and financial issues, including inequity, which really puts them at the risk of contracting and propagating COVID-19. Like I said, we are yet to control COVID and declare Uganda COVID-free, but we all know what is happening in other countries like China. Cases are really on the increase, and they are going into the lockdowns again. And when these children do not access good care, these special children, then they have high levels of mortality, and they cannot sustain their needs. Children living in detention facilities, immigrant camps, orphanages, in most cases have no arrangement for safe drinking water, food. There are lots of sanitation barriers, and also poor access to medical services. Again, my colleague from UNICEF alluded to this. And we know that some of these diseases that we are experiencing, the Ebola, the COVID-19, they are actually related. And good hygiene practices are very, very important. So you can imagine in these settlements where there's no access to those facilities, that makes them really vulnerable. Basic preventive strategies, such as frequent hand washing, which I've already alluded to, physical distancing, they are virtually unattainable in these settings. The other challenge that I would like to talk about is disruptions in essential and quality health services. The nationwide strict lockdown, we all know that, affected continuity of services because of restrictions in movement. Children were unable to visit their pediatricians. There were those who had mental. I'm talking in the past because we know that the numbers these days are very few. So all these were experienced at the peak of the pandemic. They were unable to visit counselors and to receive support from psychiatrists. And also, we witnessed interrupted supply in medications, especially for children who have got to take medication on a daily basis, like children who are diabetic, children who have respiratory problems like asthma. They were not able to access health care, and that actually led to worsening in their conditions. And we also recognize that while periods of lockdown initially provided a golden opportunity for parents to mingle with their children, and we saw all kinds of, posts on social media, what was happening in homes. However, the frontline COVID warriors, who include the nurses and other responders, were time poor, tireless, and hard-pressed. They hardly found any time for their family and children, and you can imagine the implications of this. Some had fear and guilt of contamination by the virus to their little ones, and they actually preferred to stay away from home. And in developing countries, they would actually require people who are working in ICUs to stay away from home for long periods of time. So you can imagine if you have young ones in your home, you say you're a breastfeeding mother, and you have maybe a child with a chronic sickness, and you've got to stay away from home for long periods of time. Loss of jobs by parents. Previous speakers have already alluded to this. Led to evictions. We saw some people being evicted from their homes. We saw people grabbing land. And failure to provide food. There are people who are going hungry for a week. And I would like to really appreciate the Office of the Prime Minister for coming in to rescue some of these families. But we do recognize that this support was not very sufficient. And of course, the consequences like anger. People became so angry. They were aggrieved and generalized disregard for society. And then with the consequent adolescent physical, mental, sexual, and reproductive health problems. And again here, a lot has been talked about the girl child, but we also need to reflect on the problems that our boy children are facing. Restrained access to basic health care and mental health care. This manifested in form of reductions in uptake of child immunization services. My colleague from UNICEF again showed us the graphs. Maternal health care was disrupted, sexual reproductive health services, and this ultimately led to an upsurge of unmet need for family planning and inappropriate contraception. Some actually were improvising due to lack of contraceptive supplies, which resulted into teenage pregnancies or child pregnancies, unsafe abortions, and planned pregnancies, increased rate of sexually transmitted infections, and the list is endless. The supply of essential drugs, I've already mentioned children with diabetes who really rely on insulin. They were unable to access this during and children with HIV also were not getting their antiretrovirals, some actually, although efforts were made to make sure that people get refills at home. So you can imagine a child missing their antiretroviral treatment at that formative stage. And the experience from the Ebola outbreak, the current one, has really taught us that severe limited access to basic health care would lead to the spread of COVID-19 and other non-COVID diseases of public health importance. I'm going to try to rush through the slides. Here is an illustration of the decline in the uptake of immunization services during the pandemic. I've highlighted in red the numbers during lockdown, and we can appreciate the 20%, 21% reduction during that peak of the COVID-19 pandemic. And globally, the largest sustained decline in childhood vaccinations in approximately 30 years was recorded during COVID-19, and this data is available. It was published by UNICEF and the WHO last week, on the 15th of July, and it's available. You can Google and look at the report. And there's a measure, the indicator for immunization coverage, the universal one, DPT3, and it really fell significantly. And I'll straight away go to what I've highlighted in green. Uganda was able to hold off the declines, and we actually maintained high levels of immunization, of routine immunization program coverage, while we rolled out a targeted COVID-19 vaccination program to protect the priority populations, including the migrant workers. So this is very good news for our country, that although we experienced that decline during the peak of the COVID-19 pandemic, we were able to really recover. And that report actually shows that Uganda and Pakistan are the only countries that sustained the gains in immunization, that caught up. And that was, for us, for our case, it was because the COVID, the response, the COVID response had inbuilt interventions to mitigate the declines in immunization coverage, and they are highlighted there. Effects on children. I've been presenting on challenges, but I'll quickly run through the effects. They are direct and indirect. Direct effects, loss of parental affection and care, as we've already seen. Sexual exploitation, teenage unwanted pregnancies and planned parenthood, transactional sex for fulfillment of basic needs like food, drinking water and shelter, and safe abortions, coerced begging, and child labor. Somebody talked about Karamoja children being bought to come and beg on the streets. Permanent disengagement from formal education. There are children who have not been able to go back to school, and some are actually engaged in substance abuse and child labor. Involvement in crime, self-harm, suicide tendencies. I did not give the statistics because there are different sources, and actually some of this information has already been highlighted. And very soon we are going to experience an epidemic of fear, anxiety, and depression. The indirect effects, I think I'll quickly rush through them in the interest of time. Girl children were married off as early as possible. We had a testimony from our sister, my daughter. And the exploitation of basic human rights, domestic violence, sexual abuse has already been alluded to. And when children actually are married off early and they get pregnant, they have problems giving birth because their bodies are not mature enough either to hold the baby or to allow the baby to pass. I'm trying to simplify the language during childbirth. And that condition is called obstructed labor. Somebody talked about the fistula, which is as a result of obstructed labor due to a small pelvis, the birth canal, what we call the birth canal. Children are already extra sensitive to emotional stress. Children are very irritable. I actually attest to this. I witnessed it in my household because of prolonged stay. And like I said, we need to prepare for an epidemic of mental health, the broad spectrum of mental health conditions. So what does recovery post-COVID look like? I already posed this question. Do we want to go back to the previous day? we want to do better. We have proposed some actions. It is very, we shall share this, and you'll be able to internalize and reflect on what we are proposing. But basically we are looking at transformations within the health system, but also within the other sectors to be able to get back. We need multi-sectoral collaboration, engagement of multiple sectors and actors for transformation of the system, to align it with the current and the future challenges and needs. We need to refine and align the measures of preparedness and response and measures of resilience. We talked about resilience in my earlier slides. We need to integrate resilience in preparedness and response efforts in every sector of government, public and private sectors and other sectors of the economy, agriculture, and I'm glad the Prime Minister's Delivery Unit has actually taken on this. We now have a unit that is responsible for food production to mitigate the effects of lack of food. Revisiting critical enablers, I think UNICEF already alluded to this. The software, political and bureaucratic effectiveness, trust. We know what is happening out there, how the communities are very, very, very suspicious of us health workers. And a case in point is where people have been alleging that there is actually no Ebola, that it is a tool that the sector is using to get money. These are the proposed solutions to really step up immunization coverage, although we are doing well. And then empowering communities. My colleague from UNICEF talked about primary health care, and which is about empowering communities, empowering families, individuals, to be able to promote health, prevent disease, and maintain health to cope with illness and disability. And multiple community actors working together, civil society, religious leaders, cultural leaders, working together to change mindsets and behaviors. We need to actually try and regain trust in the health system and the quality of its product. And Ministry of Health has got very good plans. Somebody talked about low staffing levels in health facilities. There's already a strategic plan, 10-year strategic plan and a 5-year operational plan to address these challenges. Thank you very much for listening.
Thank you very much, Dr. Enid, and a special thank you to the Office of the Prime Minister entirely. Getting a doctor from the normal work environment of the hospital and getting them to speak for such long hours and be as elaborate is not an easy task. But out of everything that Dr. Enid did clearly say is one, that this needs a multi-sectoral approach. It can't be the duty and responsibility of just one person to deal with the issues of children. And in our next session, which is also going to be our last one before our chief guest gets to speak to us, I am going to request, just as Honorable Mateke, you are next to our chief guest, I will request that you walk with her up, back to, because the presentations are done, you walk with her back to the high table. And I'll also request Dr. Munir to still get back to the front. I'm also going to request in that the country rep of UNICEF as well to join that team. And Honorable Flavia Kabahenda, who is the chairperson of the Uganda Parliamentary Forum on Social Protection, to kindly move back to the front seat. And last but in no means the least, I will request Lydia from the Child Fund to also get to the front. I know that many of you also could have picked up a few questions you're asking yourself. There are a few things you needed to raise to probably Madame Doya or Dr. Enid, but we are going to give you that time. After the next few speakers, we're going to give you a bit of time to ask those questions. So ladies and gentlemen, let's welcome our chief guest to the front, and also some of our panelists who are also going to be speaking from their own view and perspective of the organizations where they work, how this actually comes to pass. And as they do come, I am recognizing the Child Fund, the Embassy of Belgium, the Uganda Debt Network, the Embassy of Ireland, Montrose, the British High Commission, UIDEL, TMF, HelpAge International, Uganda Parliamentary Forum for Social Protection, Straight Talk Foundation, AFSAI Foundation, ISA, the AfriChild, the Embassy of Netherlands, the Ministry of Gender, Education, Parliament and Media as well, and all those who are present for coming through. And did we have Honorable Kasule remaining? Please come through, the head of the delivery unit. There is no way you're going to stay where you are, and also much later on you'll do the honors to help invite our chief guest, since you are also representing the permanent secretary. I'd like to start it off from Honorable Sarah Mateke, as the State Minister for Youth and Children Affairs, with all the statistics that has been displayed and the current state of affairs. What could be the long-term strategies that government is putting in place, and your ministry as well, to ensure that Uganda's policy environment and practices put children at the center of Uganda's development? Because as we did see, they are more than half of the population, and yet in most of the times we tend to look at them as the other audience that we can think for, plan for, but rarely do we get to see them actively engaged. Over to you, Honorable Mateke.
Thank you so much. Let me stand on the existing protocol, and due to time, I think I will shorten what I was going to talk about. The question is the long-term policy strategy, the environment that we have put in place as government to see how these children recover. Of course, the child vulnerability, which was attributed to COVID-19, of course, sparked a lot of things, and I will not go in details because the UNICEF representative, I think, had given us a lot of statistics and data. And I pray, Chief Guest, they give you that report, should give us that report so that we are able to build on what we have. One of the strategies that we have put in place is to have a child-sensitive social protection. What do we mean by this? Where we have public policies, programs, and systems that address the specific patterns of children's poverty and the vulnerability. And of course, looking at the rights-based approach, and also recognize the long-term development benefits of investing in children. An investment in child-sensitive social protection represents an investment in Uganda's future growth and prosperity by strengthening the human capital and building the foundations of a healthy workforce. That is one of them. Another thing that we have done, of course, when you look at the National Development Plan 3, you will see that it has put in place, or it gives an opportunity for all MDAs and non-state actors to prioritize interventions that address children's welfare across survival. We look at health, development, we look at education, protection, and participation. We have in place the National Child Policy 2020 and its implementation plan, which started financial year 2020-2021 and ending 2024-2025. It provides a national strategic direction to MDS, local governments, development partners, private sector, CSOs, in regard to priority actions and interventions to realize the 4 broad rights of a child, plus systems strengthening. Of course, we have put in place different legal reforms that guarantee children's rights and address gender equity concerns. I told you I'll make sure that I'm brief. I won't go in details. We have the Children's Amendment Act 2016, which clearly looks at the inter-country adoption and legal guardianship. We have the Succession Act. We have the Prevention of Trafficking in Persons Act, which was also amended. We also look at the Prohibition of Human Sacrifice Act 2021. We have the Public Finance Management Act, which is there to commit government to realize the opportunities in planning and budgeting by amending it. I will not go in details. Then we also have a partnership with development partners to address child vulnerability. Government of Uganda and development partners like UNICEF, USAID, UNFPA, among others, we have signed bilateral agreements to support and, of course, implementation of the National Child Policy to complement government efforts at national and district levels. We have also put in place mainstreaming interventions that address child and family vulnerability in ongoing and future government programs. In line with the Cabinet Directive in 2019, improving children's welfare is catered for under the social services pillar of the parish development model, and it provides for interventions. And also when you look at the NRM manifesto as the ruling party, it prioritizes investing in interventions that contribute to improved child welfare by different MDS and non-state actors. His Excellency the President also made a directive, and Cabinet Directive 2 in 2020, to the Ministry of Gender, Labour and Social Development to undertake a culture audit to establish cultural practices that infringe on the rights of our children. And of course, this would hamper with our growth and development if not done. Through the government, through Ministry of Gender, working with CSOs and development partners such as UNICEF and UNFPA, we have put in place 24/7 national helpline service called Sauti 116, which uses toll-free line to enable public report cases of child abuse from across the country. And we have had cases up to date. If I can give you the cases of September, different children call wherever they are. We have a network, the whole country. A child will call you from the last village, for example, in Kisoro, and we are able to send there our staff immediately. If you look at the statistics of the calls that we have been receiving, I'll just give you the one of 2022. Since January to September, we have received 321,000 calls of different cases. For example, we have had cases of child neglect, and which is topping up. We have had cases, second, sexual and physical abuse, and 32.2% of the callers are male, and 62% are female. 20% of these callers are children reporting cases, and mostly, which is very unfortunate, most times they are relatives who are sexually abusing these young girls. Ministry of Gender and Social Development, with support from UNICEF, is also developing a mental health psychosocial support. The issue of mental health should really be addressed in whatever we are doing now, because I was seated with my colleague just here, and she said, just this year, last month, we reported 9 cases, suicidal cases from children in schools. So it is something that we should address, which we have been neglecting for some time. We also have the Self-PAL app. In 2020, Ministry of Gender, Labour and Social Development, working with young people, developed an interactive online mobile application called Self-PAL. This one targets the young people, and it is used to report gender-based violence cases. The app is also used for disseminating digital messaging and promoting information exchange on HIV/AIDS, social and sexual reproductive health, malaria, tuberculosis, among others. And this Self-PAL is directly integrated to Sauti 116, which I had already told you, and has the capability to support the use of feature phones. Not only those with the smartphones can access it, even when you have Kabiditi, you can also access it by pressing *260*6#, and there will be somebody to respond to you. We also have the Spotlight Initiative program, which His Excellency the President launched, the EU-UN Spotlight Initiative on ending violence against girls and women. And this was launched on March 8, 2019. And the program is supported by the UN Fraternity and Government of Uganda. It's being implemented on national level among over 21 MDS. We have it in KCCA, we have it in some CSOs, private sector, different local governments like Telego, Arua, Tororo, Amdat, and others. And of course, the key milestones of the program, high level and strategic engagement, I will not go in details. Finally, what are the best practices that we have put in place as government to address the children's welfare recovery? Like my colleague said, issues to do with children need a concerted effort, and I don't think that Ministry of Gender alone can manage the issues of children. So we are putting in place different programs and practices which can help us address the children's welfare recovery. One, we have put in place a national strategy to end child marriage and teenage pregnancy, which is running, though we are still planning to update it. And of course, it will end in 2027. And it was launched in Butaleja on 16th June 2022, on the Day of the African Child. People may ask why we decided to go to Butaleja. Butaleja has the youngest grandmother. The youngest grandmother is in Butaleja of 24 years. We have, of course, government put in place emergency cash transfers under the Child Sensitive Social Protection Program. Since the start of COVID-19, the Child Sensitive Social Protection Program, in collaboration with OPM and district local governments and implementing partners, organized 2 rounds of emergency cash transfers, December 2020 and August 2021. The program delivered emergency cash transfers to 154,000 beneficiaries to help households deal with the immediate economic effects of COVID-19 pandemic. And of course, this was meant to help by providing essential food, security needs, and of course, we are targeting the vulnerable individuals, the pregnant, the breastfeeding mothers, and other children under the age of 2. Of course, the Uganda Child Helpline operations really helped us during COVID-19 because it helped us in handling or case management. During COVID-19, the workers were facilitated to provide critical support to children who needed it. Of course, most times why we had Most girls got pregnant, teenage pregnancy, but you ask yourself, where are these men who impregnated these children? No one even wanted to go and report. But the cases which came to us were handled. Of course, child cases were referred to RDCs in the districts where, because of the movement being stopped, some of these cases were referred to RDC's office, and where they could not manage, would have to have them cleared to travel, so that we are able to take them even to specialized hospitals, especially for the defilement cases. Majority of the child cases were sexual and neglect, followed by physical abuse cases due to domestic violence in the homes and community. Our chief guest, I want to inform you that most of the cases, if you look at the women that are in prison, women who are in prison, most of the men who are in prison, are issues to do with domestic violence, gender-based violence. And I think much as we plan that we need to develop this country, before we address these issues of gender-based violence, we may not do much. You go to police, the family and child protection unit, 24/7 is full. Go to probation officers in districts, the lines are full. So I think we need to address this issue. Of course, we are able to provide essential food to children in homes, which are managed by NGOs. And of course, we got a list from OPM, a list of 41 approved homes and 15 unapproved children's homes, and they were able to be given some support. We are able to clear selected civil society organizations to continue working in urban and rural settings. And the majority were involved in provision of essential food, healthcare, mental and psychosocial support to children and their families in their need. We are also able to partner with CSOs at national and district level to provide mental and psychosocial support services to children and families affected by COVID-19. This is a continuous process. We are still withdrawing and rehabilitating and settling the street children from Kampala. It's unfortunate that today I'm hearing that every day now, 16 new children are entering our streets again. That's why I've told you it is a continuous process. You remove them, after removing, tomorrow you find a new set. So it is a continuous program but we pray that it will one day end. But I see it not ending very soon, chief guest, because I was telling my colleague that we had arrested 16 women who were trafficking these children, and to my surprise, when I followed up to know where the case had reached, I found the women were already released. And they're the very people who are going to carry these children back to the streets. When I asked the case, they put a very different case. It was not trafficking. They said they were soliciting for money, something, a very funny, interesting case. So we still have a long way to go to remove these children from the street, because they are being brought by us, the adults. Of course, we are supporting pregnant mothers, the pregnant girls and mothers, to manage their lives and care for their children. It's not easy. Chief guest, I was in Arua, and I met, I think Arua Ulu, I met a girl of 9 years with a baby. And she was crying and the baby was crying. Now I said, what do you do in such a case? Because she had seen the Minister of Children, so she expected an answer from me, and she was a total orphan, and the guardian of this young girl had also chased her. So you can imagine such a scenario. And that is only one I met out of the very many that are outside there, who need hope, who need help. That's why I say that issues of children need a concerted effort. It is not only me, but I request everybody to come up and we support these young girls. Of course, we have had the national campaign to end child marriage, teenage pregnancy, and promote positive parenting under the theme Protect Girls, Save the Nation. This was launched by the First Lady, the Minister of Education and Sports, Mama Janet Kataham 7, on 3rd December, 3rd October. And we have put in place a national interministerial committee, and the campaign is continuous. I believe that what is going to happen in these 2 months, because the holiday is a bit long, I pray that every parent takes charge. Of course, we have continued as a ministry to conduct research to generate findings to inform government and development partners. We need to come together regularly, as I conclude, so that we are able to set goals and objectives and strategies and interventions and register the milestones. Where we find we are not taking a step forward, we innovate to do things differently to register better results. Each day I ask myself, government has put in place policies, has put in programs, we have had the law reforms, and ask myself, where are we not getting it right? There must be something that we have not touched that is still, Chief Guest, each time I move, I always say the whole problem starts with us, the parents. If we do the right thing as parents and do our role as parents, I believe we can have a change. Thank you so much.
All right, thank you very much. I think that was very elaborate on what government is doing, but a few sad ones coming through. If you're receiving 321,000 calls, one would ask how many are those who would have loved to call, but they cannot just merely be able to access and, raise their issues coming through. But I love when Honorable Mateke speaks about the interministerial committee, which speaks to concerted effort. It's not one person, but it's going to be everyone to come through. This is where I would like to bring in Honorable Flavia Kabahenda, who is the chairperson of the Uganda Parliamentary Forum on Social Protection, on the role of the legislators in ensuring that the budgets reflect the need to be able to cover the lost gains. The Honorable Minister Mateke has listed an array of legislations, and I would ask myself, is it about implementation? Is it about the resources? Where are we going wrong?
Thank you very much, Mildred. And I am Kabahenda Flavia Rapul. I represent the people of Chegebo district, and I'm the chairperson of the Uganda Parliamentary Forum on Social Protection. Parliamentary Forum is not a statutory committee of parliament, but it is, if we took the Commonwealth practices, it is an advocacy group. Sometimes they call it a pressure group that gets the members of parliament who have a common interest in social protection, much as these would be handled in the Committee on Gender, which of course you know that handles a number of departments. So these members decide to come together with this common interest in matters of social protection so that they can do evidence-based researches, work with civil society and NGOs and every stakeholders, government and non-state actors to ensure that they assist the Committee on Gender, Labour and Social Development to articulate issues, not only in their reports, but these members will be on the microphone in the House to articulate the issues of social protection per se. And so the Uganda Parliamentary Forum on Social Protection has now so far close to 150 members subscribed. And you know that in Parliament we have our 4 core roles of oversight, appropriation, legislation and representation. And we do exactly that because we go to the field, we find out, we share and validate researched information with civil society organizations and research work, academia, and then we come to the floor and give these issues with evidence and facts and of course data. And so as members of the Uganda Parliamentary Forum on Social Protection, being that we are members of Parliament, of course we are both members sitting and members who left Parliament because we harness on the information and awareness that we give so that we together push for these factors. When you look at the children, especially after COVID, because these children, we started realizing after COVID, but these children have remained behind for a long time. If UBOS tells us that 54% of our population are people who are below 18, then every one of us would stand up and say, okay, so can each one of us maybe try to work with one child, because we are almost parity. These are the ones who don't vote, like Mildred said, but then they are supposed to get all the services that we talk about. Children, therefore, became the hidden victims of COVID-19 pandemic, not only because they contracted COVID, but they were also among its most severely impacted victims, and this may permanently damage our shared future, because they are our future. And you know that in any crisis, the young and the most vulnerable suffer disproportionately. It is our responsibility to prevent suffering, save lives, and protect the health of every child. I thank all the presenters who are here, because they emphasized that much as we know the notion of home is the best, these days, home is no longer the best. Very unsafe. One of the girls who committed suicide recently left a letter to the parents and said, the uncle who came and spent a holiday here abused me throughout his vacation, and I did not have anyone to share this with. She started deteriorating in class, and then the parents brought a teacher to coach her. The teacher also abused her. So she was in a series of abuses, and the parents had no time. These are the ones who wake up at 5 and come back at 10, even when sometimes they are tipsy or drunk, for that matter. And so she had nobody to share it with, and she said, I became a loner in a house of people. So the only thing I should do is to exit. And she exited the way she did. And so this should speak a lot to us. For us who are looking at social protection, and how government really needs to tie all the loose ends in as far as especially social protection for children is concerned, we are going to share with you a few of what we are doing as legislators who are members of the Uganda Parliamentary Forum on Social Protection. The socio-economic impact is going to be felt the hardest by the most vulnerable children. Many already lived in poverty, and the consequences of COVID response measures plunged them into further hardships. You know the measures. Wash your hands. That means they were supposed to keep going to the wells. You know the distances our water sources are. They were supposed to keep fetching this water that the people had to wash with. Don't go out, stay in. All those measures that we put actually exacerbated the problem. Today, as we talk, labor migrations and labor externalization has become another issue on children. RR4C has just come up with a report they shared with us. 62.7% of young people between 20 and 30 years have intentions to migrate. 20 and 30 years are mothers, they are parents. They just drop their babies there and go. And then the babies are left with people who cannot just look after them, who cannot stay with them. And these are the very many issues we have now with the children coming to the streets because the mothers are migrating. And this is an industry which I think the government needs to sanitize and to even provide real safe pathways and to even do a study, a cost effectiveness of whether it works for government for us to externalize our labor than if we used our labor. Because we may be just talking like the bandwagon that there are no jobs, there are no jobs, when no technical report has come to actually show us that this country does not have jobs. If someone can get 7 million and pay for labor externalization, is that not enough capital for them to have a job? So we need now a technical study on, is it real that we don't have jobs in this country? Is it that that government gains from this brain drain of people going out and then come back with nothing you can harness, not even skills, and they are always crying, and then the children they leave behind are left in jeopardy. Of course, we as Parliamentary Forum on Social Protection are partnering with WFP and UNICEF on a program of child-sensitive social protection that is being implemented in the West Nile in 7 districts, most of whom are actually hosting refugees, on the money that they are giving to lactating mothers and pregnant mothers. It is supposed to be 48,000, but when they put apart what they should save, because there is also the component of taking them through a saving system, so they remain with around 33,000 per month to support food and nutrition and to be able to carry these babies both in the wombs and possibly after birth, and they support them in food and nutrition. And the hurdles we have discovered in this very program, like every other programs, and I'm very glad that we are talking to the Office of the Prime Minister that coordinates this. The requirement of the National Identity Card for the vulnerable people to access social protection, I think, is very prohibitive, it's very discriminatory and marginalizing. That if I want to get 100,000 for relief, I have to show a national ID, when you know that 40% of the people who would get IDs don't have them. Even those who are holding IDs, they were flawed in the writing of their names and the ages, they can't work. And then, as if that is not enough, you need to have a mobile phone. We know that very many women are not even allowed to have phones in the homes, the vulnerable women who have these children, and so it becomes so prohibitive. Social protection for older persons requires national IDs. This child-sensitive social protection in West Nile requires IDs. NIRA is underfunded. Their technology is obsolete. They are not in every district. Arua, for instance, the Arua office of NIRA is serving 5 districts, 4 staff, and so we as members of the Uganda Parliamentary Forum on Social Protection are actually coming up with a motion to task government to ensure that NIRA is equipped, that NIRA is staffed, that national IDs are scaled up to be able to make these people access the social protection services. I want to thank UNICEF and WFP on that program, but on our side as government, I think we need to up our game on providing national IDs. As millions of parents struggle to maintain their livelihoods and incomes, government must scale up the social protection measures. And as members of the Uganda Social Protection Forum, we are advocating for a national social protection strategy for this country. We are advocating for an updated investment case for financing social protection. Of course, we are aware of the very many social protection interventions that are very scattered, because you can hardly even talk about them, but they are there, scattered. And we need now to rewire systems so that these interventions are harmonized. And secondly, we need an audit on every intervention to see whether in the planning, in the implementation, in the fabric, the children are in the strategy. Or we leave them to just benefit by default because their mother got, so we assume that the mother will give. I think we need a more strategic approach on monitoring to ensure that the children really get it. Finance and operationalize the social registry. We have a problem with data in this country. We need to invest in data and statistical systems. The national identity card for adults is for free, but the birth certificate is not for free. So I don't know, is it the baby who is born who is supposed to pay for it? Or the mother is the one who is being charged for having delivered this baby? So she has to pay to identify and give a nationalism and give a citizenship to her child because she bore it. So these are policies that we need, I think, to discuss with government to ensure that even the registration of children is made free, so that even the child who is born under the banana plantations can be able to be registered. Yes. And allow me to 3 more issues. The local governments. The Local Governments Act requires that every vice chairperson at LOC is the one that is in charge of children and family protection. I don't know whether they know their mandate. I don't know whether their families are stabler. I don't know whether they are not the ones now impregnating these girls. So I think we need to strengthen this system of local government, which is by law, that if they are going to be charged with this, let them be given enough information, enough awareness on how to execute this mandate. They are the nearer to clients. They would be the ones even identifying the men that impregnate these girls, because it happens there. But they, to me and to us as members of the forum, we seem not to see them taking on this. We can also harness the will, the goodwill that the First Lady and the Vice President have expressed, because the Vice President read a motion on the floor about protecting the children, and for us that is political will. But can it come now with policies and legislations? If we have parenting guidelines, can we have a policy on parenting, which in turn may become a legislation, so that we enforce that here in Uganda we don't have only mothers and fathers, but these mothers and fathers transform into parents, because everybody seems to be very fertile, that they can make babies, but now when it comes to parenting and nurturing, there the problem starts coming. As I wind up, I think in health, we as a forum, we are advocating for youth-friendly corners at every health center, free, to assist these young people with information, with education and counseling, and so let them work at every health center, free at least, so that these young people, even when they are pregnant, even when they suffer from these diseases that they cannot disclose to their parents and siblings, they can come and find a place where they can get this guidance and counseling. The decreasing protection of subventions of government, for us, is a worry. That the Ministry of Finance is now threatening that the subventions are going to be protected only up to 20%. For us, it worries the vulnerable people, because that means the money that has been going to these social protection areas now is open for cuts, open for diversions, open for anything, as opposed to earlier on when the subventions were 100% protected, almost ring-fenced, so we would know if it is money for social protection, it will not be touched, whatever shocks. But when you lose the protection, then that means the goodwill is gone. So we would like to call on Minister of Finance, Madam Guest of Honor, that they should not dare to do this, to lose the protection of this. We are also looking at health insurance for the children with multiple disabilities, those with spina bifida and hydrocephalus, who are left to Chua Hospital to pay 16 million so that they can correct some of their disabilities. We have children who are blind, dumb, and deaf. We have children who are deaf and crippled. These would be having at least a health insurance. If we have failed to secure the national health insurance for all, at least let's secure this health insurance for children with multiple disabilities. Cost requirements for corrective attention for children need to be subsidized. The government needs to come in so that these children are supported. Of course, mental health investment, the minister already alluded that in October alone, 9 children in school, secondary and primary, hanged themselves. And this calls for a mental and psychosocial health address in the schools, career guidance, guidance and counseling, so that they can be supported. And finally, we have gone for oversight on remand homes. And of course, predominantly the remand homes have boys, unfortunately, and no girls, almost. But these remandees, by law, are supposed to be at the remand homes for only 3 months. And they either go back home or they are charged accompanying us. But we have found remand homes having children who have spent 9 months. These are 8 years, 9 years, 10, 15. They want to go back to school, they want to go back home. Some of them were used by adults because we found a Kasese boy in Fort Poto, 9 years. He was charged with adults because the adults were using him to fall into the houses to open locks so that they can steal and rob. And so he has been here for 9 months. And they were crying, we want to go back home. Now my fellow pupils are doing exams. For me, I have not done exams. So we need, I think, to, as the legislators, we are calling on monitoring, we are calling on audits on how these interventions perform. And we as legislators, we have now adopted a post-legislative scrutiny to see whether even the very many policies and legislations really are touching on what we intended to chua. And so I would like to call upon every one of us that this is everybody's business. The children are our children, Mandela said, and he said we need to be true to our children. Thank you.
Thank you very much, Honorable Flavia. Very passionate about issues, social protection. Ladies and gentlemen, you're going to allow me switch up the program just a little bit because just last week as a journalist, I know that we were capturing a lot of discussion about what was termed as absenteeism, but also I clearly know that there is a critical aspect and critical issues that our chief guest needs to be addressing in Parliament, and the Parliament, she's holding Parliament hostage right now because of her absence there. I am going to allow I'm going to allow Honorable Sabunya to invite for protocol matters. Well, she's already here, and ladies and gentlemen, let's welcome the Right Honorable Justine Kasule.
She's already invited.
Thank you so much, the MC, and the Honorable Minister of State for Children Affairs, Honorable Sarah Matechi, Nyirabatitsi, Honorable Flavia Kabahenda Mhoro, Chairperson of the Committee on Gender Issues, but also Chairperson of the Social Protection Committee that handles issues to do with the children, but also population and food. Honorable Sabunya, the head of the Prime Minister's Delivery Unit, Your Excellencies, the ambassadors and high commissioners, the UNICEF country representative, the representative of the permanent secretary, representatives of the different development partners, civil society representatives. I've seen children around, those who are the reason we are here, the media fraternity, ladies and gentlemen. I wish to take this opportunity to thank you all for having come to participate in the Recovery and Resilience for Children National Dialogue. Let's clap for the organizers. Let's clap for the Office of the Prime Minister. Let's clap for UNICEF. Let's clap for ourselves. We may talk too much, but after listening to you, I've also been pulled down in terms of thinking and focusing. Yes, we have the bigger government. Government is amorphous. Government is in your bedroom. Government is in your sitting room, in your compound, on your roof, under your foundation. Government is on your gate. Government is outside your gate. Government is in the air. Government is everywhere. But before we talk of government, most of the challenges we are talking about are recent challenges, issues to do with children, or they've been exacerbated by different reasons or different issues that have happened to us. Who are we to blame on issues of children? Blame yourself as an individual first. I blame myself as an individual. Why? I'm a mother of 2 sons.
But our culture does not give me responsibility. Put aside the post of ministers or a leader. Does not give me responsibility to look after my 2 sons only. No. Culturally, when we were growing up, if you misbehaved on the road, any neighbor, an elder would beat you. And you have to keep quiet and you don't tell your parents that have been beaten. Because if you tell your parents, you will get more. Now, that was community responsibility. So it ceased to be the individual parent, ceased to be the family. It became responsibility of the community. You as a child, do we still do the same? We don't. And when you would grow and now you leave your home, apart from the community being more responsible and taking care and monitoring you, we also had the religious institutions. Our culture itself would tell you, leave the few practices where certain cultures would abuse children. Like when it comes to eating chicken, children are not given chicken because it's for the adults. If it is a fish, the head has to be eaten by the head of the family or the mother, not the children. Yet they need that eye to develop and be brilliant and bright, much more than the parents. When they are serving food, they would begin with themselves, the adults. Yet for them, they are eating to survive, and the children need the food to grow. They should be served first. Then the female genital mutilation. So put those aside. Our cultures were so good and very protective of a child that if you lost your parents, the family would immediately take you up and bring you up. Do we still do the same? Including those who have gotten money. They think of their nuclear family. English came in. Yes, helped in some areas, but made us degenerate and run away from our responsibilities, which have been bestowed on us by our cultures. Come to religious institutions. What is happening to religious institutions? Are they all doing what they are supposed to do? Are they? They're also equally, some of them are even abusing both children and the adults. But when we go there, we only bow and genuflect and kneel. Do we tell them that we also have challenges here? Do we tell them that we have run away from your responsibility? They blame us. Sometimes they backbite us. Is that offering solutions? So what you are discussing here calls for candid discussion. And we should create bigger platforms, bigger than this. Can we, as OPM, go and hold a discussion with the religious institutions in this country? Tell them how they have run away from their responsibility and how some of them are abusing the children. Let's go and have a discussion with cultural institutions. Some of them have become showbiz platforms instead of doing their work. While we politicians show off, they also equally compete to show off with us. So who is responsible? Who is following up on the other? We have taken on a culture of criticizing everything. Where is the platform to find a solution? For us, we have platforms. We have cabinet, we have parliament. Is that sufficient enough? Even if every constituency has a representative in the parliament, can the MP know whatever is happening in a household? How do we increase our base of getting information so that we help our children? But equally, when it comes to the children, have we given them time for parents? So, when we talk of the pandemics, they've just exacerbated and brought the problem to the surface. It has been growing slowly. When we took on the capitalism way as approach to managing our economy, where has it left our children? Where has it left us? We wake up as mothers to run to go and make ends meet. You put milk in a bottle for your child. While some of us had the opportunity to get the mother's milk for 2 years, why are we mean when it comes to our own children? What are we doing about that? You know very well the importance of the mother's milk when it comes to the child, especially the development of the body and the brain. What have we done, we as government, to enable this young mother feel comfortable even at the place of work, to be able to breastfeed this baby, at least for 1 year at place of work? We bosses who are supervisors of the many, what are we doing? We call meetings at 4, at 6, but the majority of the people in your departments are young people. When are they going to go home, to look after the children, to have time to bond with the children? We've left our children to TVs. Technology has come in to replace parenting. What are we getting out of it? What are we reaping? And I want to tell you, those who are here, those who are suffering most, especially here in Kampala, are those you look at and admire. Those with big political posts, those with big businesses, big accounts. Their homes are no longer homes. The majority of them, their children are suffering even worse than what you are describing here. You've seen where we've had some cases where a colleague loses a child. We've lost children, but no one can explain the cause of the death. Even when you go to attend burial, they will keep quiet. When the parent gets up to say, begins to it's like praising God, but never inserted that doctrine of God into that child. But the child is gone. So what you are talking about is an issue that's so pertinent. You're talking of children, yes, they've suffered, the cycle of suffering. You pushed government using new technology, new era, and the corporal punishment was removed from schools. How can you evaluate that policy? Has it yielded positively or negatively? We used to fear Chibok. I grew up in a community where I was, Chibok. The Minister of Education, in charge of higher education, Dr. Chirizosto Muyingo, was my head teacher in HSC. But nearly citing him, you straighten yourself because you know what happens. Don't look at him looking politely here because he's a minister, but he would slap us, he would beat us. That alone was enough for you to straighten up yourself. There must be measures to restrain a child so that a child grows up with self-restraint. We must put up measures. If a child cannot listen to the parents, let the child listen to an aunt. So, as we talk now, technology has come up, we are giving our children smartphones. Do we check what they look at? Quite a number of children with smartphones don't sleep. They are online throughout the night. Doesn't that affect their brains? We are here clapping, technology has come. What much effect in a positive way has it had on our children? Whenever we talk of jobs, yes, I've talked about those employed by government, but those who go and work in factories for 12 hours, we need to improve our labor policy. And by the way, the policies we have are good and the laws. Where we need to improve, I want to tell my colleagues, it is enforcement. What we have on the shelf, the guidelines, the laws, the statutes, those are all the statutory instruments, they're all good. But enforcement is where we are faced with challenges. But government can also not achieve alone, minus the support of the parents and the communities. So, government has carried out immunization. Government has tried as much as possible to handle domestic violence, especially that affects children. Government has tried as much as possible to provide education and facilities to the children in the schools. Health centers, those are all targeting the children. But we need to improve on monitoring, evaluation. We need to improve on reporting and informing policy, changing policy based on what is on the ground. When you look at the music we have, yes, the music we have, the music industry, if you really analyze most of the music, especially in the Bantu languages, those which I understand very well, there is always an element of bad message to the children. They sometimes mask it, sometimes they don't mask it. How do you begin singing your Woma Woma? What will the children understand with that? Aren't you pushing them into it? So we have under the Ministry of Gender, when it comes to creative industry, we have a body that is supposed to vet music before it gets out. But now we have smartphones. I can also sing here and throw it to the media. How do we control that when it comes to technology? We have a lot to do. We have a lot to get back to what was good in our culture, what can suit the current, bring in technology, but not devastating to the future. And as we do that, also climate change is affecting us. People are so quarrelsome these days. Do you know why? Because it shines a lot. It shines a lot, and they wake up every day. Their minds are too hyper. They've had less sleep. They're struggling with the issues to do with the COVID, economically, socially. But what they resort to is to find, and by the way, is to quarrel. If you want to see this, go to Toro, where the environment is equally still a bit intact. And Chisoro area, there is less quarreling. But these other areas where they've destroyed the environment, wow, the quarreling is the order of the day. It's like it's prestigious to quarrel, to blame. Just look at the country, small country, Uganda. Compare people from Toro, who are living in Toro, and those who are here. Those of us from Eastern, Central, we've destroyed the environment. It has also an impact on us. So I want to, in the interest of time, because it is coming to 2 o'clock, and I have to see the speaker before plenary begins, I want to put emphasis that government has done its part, but government has a lot more to do. But all that we are talking about is also something that can be, especially for the rural communities, that can be solved if we empower and give financial independence to the parents of the children. Then we handle the next stage that is faced by those rich men and the women and the politicians and those who wake up very early to go and work, who are now capitalists, looking for money at the expense of their families. That will also help us reduce, especially on the numbers of children. You know, the fertility rate has come down from 7.2 to 5.6. I think 5.6 or 5.4 fertility rate of the women in Uganda. But still that is high. 5 children in the current situation. How many rooms are you going to have in a house? Will you be able to feed them? Will you be able to provide for them enough? And will you be able even to look after your family? So it is important, and we should create synergies that we as Office of the Prime Minister, together with all the ministries and other arms of government, make sure we improve. We keep improving every day, because every day sets in new challenges. Like the minister said, you went as a minister, you find a 9-year-old child with another child, what do you do? We should have a system immediately where that child is taken over to be taken back to school, because cannot even go back to the parents, the grandparents, because they chased him, and also government takes over the child. Let's empower our communities, first of all, to take over that. The few that cannot be taken over by the communities, government should take over, because that is the setup that we have. So the major goal of this dialogue is to draw on insights from research and current programs that help generate recommendations that will shape and improve policy interventions and investments for the children across the country. With the intentions of improving, I would want to have delivery unit, I would want us to have a report after here, so that as we do the budgeting, this is part of it. The Minister of Gender has read quite a number of interventions. Some are going on well, but some are not going on well. But there are those which were also not going on well before COVID. But those that have suffered because of the budget cuts, let's protect them. Because in the Parliament, in the Cabinet, the children have only ministers to talk for them and the MPs, but you are here now as a voice for them, so that we also take it up when it comes to resource allocations. Let's come up with a comprehensive plan to manage the current. The plans we had were before COVID, but post-COVID, the problems have gone up. Let me give you an example. You find communities where they've built one small house, the father and the mother in one room, and the children are in the other room, and there is no ceiling in the house. So whatever is happening on the other side, the children are listening. They are human beings, and that stimulates their reproductive systems very early. That's why you find those of 9 months. If you go back and research, you'll find at one point, these children were exposed to such noises that stimulated them and pushed them into that. That takes us back to the community level. When you would grow up and you're of a certain age, they would remove you from your mother's bedroom, push you to the next room. And when you grow up, they remove you from the main house, push you to the boys' quarter. That was the intention. Do we still do that? If we are doing it as the educated and planners of those in the rural areas, have we encouraged them? So, I would want to request that let's all pump motivation into ourselves and work for the good of our own children. The beauty of it is that everybody in life, whether God didn't give you a child physically, you all have an attachment to a child, provided you're a human being. Like somebody said here that even all of us are people's children. Whether the parent died or not, we're also a child. But you're now a big child to cater for the other children. Take up that responsibility and motivate and work for everybody. I want to request that you allow me to stop here and run to Parliament, because I'm remaining with only 10 minutes for business to begin, yet I've not even concluded with the Speaker so that we begin on good notes in Parliament. I thank you so much. Thank you, UNICEF. Thank you, Minister of Gender. Thank you, Chairperson and the team of Social Protection in the Parliament. Thank you, those from the civil society, business community, development partners, most importantly, our children. Can we clap for our children? Can you stand up, children, for recognition? Children, can you stand up for recognition? We recognize you and we celebrate you. But my word to you, you are 1, 2, 3, 4, 5 who have managed to come here. You are representatives and you are blessed. Work hard to be leaders who will make sure you protect those children who will come after you. Thank you so much.
Thank you very much, Right Honourable Minister of General Duties, Right Honourable Justine Kasule Lumumba. And just as you're still standing, all the gentlemen and ladies on here will take a group photo as you are, and then we'll allow the Right Honourable to leave. But we'll have just about 20 more minutes to go through our next session, and we'll be closing this off. I know well that Honourable Sarah Mateke will be staying here, and therefore because of that, yes, we are taking a group photo. There is a cameraman right there in just a minute. And as the Right Honourable does leave, Honourable Kasule Lumumba will request Honourable Sarah Mateke to stay for another 10 minutes, and we conclude the next session. All right, thank you very much. You can get seated to the rest of the team. And I will request personally Mr. Sebunya to see out the minister, because we are keeping Honorable Sarah Mateke with us here. And we'll also be letting her go in just the shortest time possible. But thank you very much. We know how important it is, and I know that in a way or two, you're going to be able to let the speaker know the discussion that we've had here as you joined us. Thank you so much for the dedication. And I love that she talked about us being responsible, whether you have physical children or not. And as we get to have our next discussion in the next few minutes, I would like to listen in from Dr. Munir on the gaps. We've talked about these policies, we've talked about what is being done, but clearly we are not where we want to be. I loved earlier on when we did have Tawanda ask that sometimes you just don't need to be comparing ourselves to other people. You sometimes need to do an introspection and ask, is it where I am supposed to be? Is this where I would love to be? Even while others are doing better or worse than I am. So Dr. Munir, please take it up on where are some of those gaps and how can we be able to close them?
Thank you very much, Madam Host, and I stand on existing protocol, and let me be very brief. I promise 5 minutes and 4 points. Where are the gaps? First gap, let me take health. If you look at the delivery of the national minimum health care package for Uganda, the estimated cost is that it costs about $28 per person per year to deliver the minimum health care for every Ugandan. The government of Uganda should be spending $28 per person per year. At the moment, the government of Uganda is spending $12 per person per year. And that's why we see the gap. We see many children are missing immunization. We see many children are dying of malaria. And we see primary health care is not functioning. And we see the outbreak of diseases just like Ebola is hitting us now. So the gap between the $28 that should be spent on every day, every year, and what is being spent, which is 12, is $16. So this is a gap. We hope that the government will increase spending on health care for every individual by $16, and we will see people healthier, and we will see less people getting sick or even dying unnecessarily. This is one gap. Let me take education. The target for countries like Uganda to deliver quality education for every child is by spending 20% of the national budget on education. You need to spend 20% of your national budget every year on education so that every child receives quality education. At the moment, Uganda is spending less than 9% of the national budget on education. As a result, there is a minimum, I would say a minimum, of 3 million children who have never seen a school in their life in Uganda. As a result, we have a wonderful thing also we need to celebrate, that Ugandans, parents, they value education. Every year, parents, they take 2.2 million children to enroll them in primary level 1. 2.2 million. So parents, they value education. But the majority of these learners, they drop out of school before they complete primary education. Why? Because of the very expensive out-of-pocket school expenses. While we see at the moment 2.2 million children joining primary 1 every year, you know how many are completing high secondary school and qualifying for university education? Only 110,000. Almost 95% of those who join primary 1 they don't make it to complete high secondary education. It's a wastage. We need more money. This is a big gap. The third gap is about social protection, as the Honorable Flavia mentioned. On average, African countries are enrolling about 18% of the population on social protection benefits. So around 18% of the population in many African countries are benefiting from one social benefit package or more. In Uganda, only less than 3% of the population are benefiting from any social protection system. You know what? The labor force survey published very recently, a few weeks ago, they said child labor in Uganda is alarming. 6.2 million Ugandan children between the age of 5 and 17 are in the labor market. They are working rather than being in a school or in skill development. That is 42% of the children are working, not learning. If they were benefiting from a social protection system, they would not have had to leave work, school, and be in the labor market. That's alarming. And the last gap I want to mention, as Honorable Sarah Mateki mentioned, the enforcement of the laws that protect children. Uganda has some of the best laws and regulations on paper to protect children. But the enforcement is not receiving enough money. These are laws on paper. As a result, every day, I'm emphasizing, every day, more than 1,000 teenage girls are becoming pregnant. More than 1,000 teenage girls are becoming pregnant in Uganda every day because the laws, which are very good, are not enforced. There is no money to enforce them. Police are not well trained to investigate crimes against children. And when you take the case based on a police investigation to the court will dismiss the case. The investigation is not done properly. If it's a sexual assault, the medical personnel do not know how to preserve and protect forensic evidence. You take the case to the court, and most probably the case will be dismissed. And as we mentioned here a few minutes ago by Honorable Flavia, many children are sitting in detention. That is not the law. The law in Uganda is very clear about the minimum age of the minimum age of criminal responsibility. Yet, children who are not yet as old as they should be to be held criminally responsible for their acts are being detained. I was in Karamoja very recently during the food insecurity, and I visited one of the districts, and I saw many children in detention. And the social worker person, he said, I have no money to take them to where the court is, which is in another district. And I have no money to feed them, and I don't have the authority to release them. That's a crisis. So, thank you very much.
Wow, brings chills. That's the reality. Very brief and precise, but very chilling, the stories that are coming through, and that is the reality of what is on. So if you've been asking which gaps need to be, tapped, that exactly that Dr. Munir has highlighted. And I will request our technical team to just prepare 2 microphones, because after our next speaker, I'll give an opportunity to at least 1 or 2 children, but also a few of us would like to speak to the discussion that we've been having before I then continue to stand in the way of your lunch and myself. Allow me ask Lydia from Child Fund. You work with these children, you understand what is on ground, what needs to be done better. Of course, picking up from where Dr. Munir has highlighted those chilling statistics there.
Thank you. I think most of what actually needs to be done has been discussed today. And one of the key things that I'm actually looking at is investment in mental health. I think we really need to invest in mental health. If we have 9 cases in 1 month, which are actually registered, how about those that are not registered? Mental health is something that has actually increased with the COVID pandemic, and so we need to see how do we actually prioritize mental health, how do we provide for psychosocial support to the children, and we're not only looking at the girls, but we also have to look at the boy child. How do we ensure that the people that are working with these children are of mentally they are of good sound mind? Are they actually going through psychosocial support classes too? Are they having psychological first aid classes so that they are also able to deal with the stress that comes with handling these children? The other thing is about developing a comprehensive emergency plan, recovery plan. We've talked about COVID, but we are seeing that there are many more emergencies actually coming out. COVID is just one of them. Are we prepared for any other emergency that is coming? And remember that with the emergencies coming, the children are more affected than any other vulnerable group that we are looking at. The other thing maybe I also have to emphasize is the need for increased budgeting for all sectors. Let us not only look at specific sectors, look at protection, look at education, look at health. Let us be able to increase budget allocation to the child protection sector. And when we actually did an analysis together with AfriChild, in one of our budget analysis for child protection is receiving 0.01% of the national budget. And yet, if you notice, all the issues that are being talked about are actually child protection issues. There is a linkage between child protection and all the other sectors. If we are not protecting the child, definitely you will not have educated children. They will go through the education system, but you will have adults who have some kind of mental issues. You will not have very good results at the end of the day. You're seeing all these issues with adults. It stems from the home. And the home is where we are having more protection issues. So how are we actually addressing those issues? There are also issues about economic empowerment. We can do better. We've talked about social protection. How do we increase that allocation and ensure that we have more than 3% of the population actually benefiting from social protection. We can also do better in improving on menstrual hygiene. It's one of the key issues that leads to dropout of children, especially the girl child in school. How are we ensuring that they are managing menstrual hygiene properly? Are we providing materials? We have had a discussion on sanitary towels for a long time, but we also know that the school dropouts is linked to menstrual hygiene issues. So how do we actually improve that? Are we also looking at providing equitable access to high quality, child-friendly, integrated early childhood development? We know that this has entirely been left to the private sector or CSOs. How can we ensure that government is actually taking this up and ensuring that we have quality services provided? Because as per now, within the sector itself, there needs to be a way of ensuring that there is provision of quality services on ECD. I won't talk much about implementation. We've talked about it a lot, but what we need to do is strengthening prevention and response on violence in schools, but also within our homes. There's a lot, if we notice during the lockdown itself and COVID, we had a lot of cases of violence against children committed by parents, guardians. The children themselves are also committing they are also abusing their fellow children. How are we ensuring that we are actually strengthening the mechanisms? we have one probation officer in one district. The probation officer is supposed to look at issues, all issues surrounding children. But remember that there are also domestic violence issues. All these people are coming to that one officer. Is that person able to respond to all children's issues? So we need to see, how do we strengthen the system? How do we ensure that we have more people responding? Yes, we have a child and family protection unit. We have one officer there. If you actually go, the lines that are there just discourage some children from actually sitting to wait, because the more you have many more people, the more people get discouraged. Even us as adults, we get irritated when you go to get a service and you're not being attended to very fast. So how do we improve on that? I've talked about the services, generally ensuring that we have more services, community-based services in preventing violence against children in our homes, but also within the communities. I also thought that there are other ways that we should be able to work. We need to strengthen the collaboration between CSOs, government, and the private sector, especially with the increasing numbers of child labor. We're having a lot of the children employed in the informal sector and in the private sector. How are we ensuring that we are collaborating on that to ensure that we protect the children better? We know that the numbers of children actually in child labor increased because of the COVID pandemic. So how are we addressing that partnership? And then lastly for me, scaling up of parenting and caregiver support programs. We need to address parenting issues within this country. I know the minister has talked about it, but there are many more issues regarding parenting. And I know as parents we are to blame, but how some people do not actually know how to parent. It's something that is funny, but people don't know how to parent. How do we ensure that we teach them how to parent their children so that they are able to raise children that are responsible? If a parent does not know how to parent, it will definitely trickle down to the child. And the child will grow up to be a parent that doesn't know how to parent. So for me, those are the areas that I think we could do better. And yeah, thank you very much.
Thank you. Thank you very much, Lydia. Lydia highlighted actually the point of psychosocial support. And I just remembered last week I was having a discussion with a colleague at work, and she was worried that her 4-year-old son was complaining, and she actually thought and was seeking guidance that looks like this child needs to have some either counseling or what. That is what I say, that you may look at that child thinking they're young, but they also have their stress. They also have issues they are going through, and you need to pay attention to them. I will give it just a few. If you have an issue to raise, or if you have some supplement to make, or if there is any question, I'll give us a few opportunities to go through, or the children here, you could just raise your hand, and if you have any, all right, there is a hand. Actually, literally all the children will need to speak. There is a microphone on your table, but there is a microphone here. Just wait, there is a microphone coming through. Feel free to let us know your name and then speak to us. If you don't mind to stand as well, that is okay.
Good afternoon, everyone.
Good afternoon.
I'm called Nega Alice from Tabiole Kazwan, where I say to, and it's appropriate. And I think you know why you say.
Yes, I do.
What I can talk about, what I can call the supplement is about the heresy issues to us as adolescents. Yes, we see they are putting much focus on other things, but there are also other adolescents. We face a problem in having healthy services. Like you can find that in an area where I live in a community, to find a hospital where I can go for the services, of a long distance. That really discourages me. And when I decide to go to the nearest clinic, still they will have to ask me money, which I don't have. And I'm sure in Uganda it's really common where I find a family which is complete, but in an actual sense it is not a complete. Whereby you find a mother, she's also a father. Yes. So, what I can talk about the health, they should also create an adolescent chorus in health centers.
Okay.
Yeah, because I can't interact with the youth. They will be speaking either issues which I have even no idea about it. Okay. So we're also facing other problems. You see, in clinics, they always, I think they care more about the common diseases. But we as adolescents, especially girls, we face a problem of UTIs. You know that we are all facing that due to the poor sanitations in our communities. Even the problem of ulcers. In Uganda or in the schools, you can't find anyone. All my friends at school, even me myself, we are facing a problem. We are suffering from ulcers. It's really a big problem for us. Okay. But for that, we don't have a solution for it.
All right, thank you very much. Alice, as you conclude, and then we give a microphone to the others.
I conclude thanking the KCC who came up with this program, Girls Empowering Girls, funded by UNICEF and Uganda Youth Development Link, in short, it's YDEL, as a partner, working with the girls to support us.
Okay. Thank you very much, Alice. Friendly corners, youth-friendly corners in health facilities. I think that is the biggest elephant in the room for many children accessing, and adolescent girls as well.
Thank you so much for the opportunity. All protocol observed. Good afternoon.
Good afternoon.
Once again, my name is Kiasilia. I am a primary 7 vacist. I am supported by KCCA, UNICEF, and Trailblazers Mentoring Foundation through Girls Empowering Girls. I also want to thank you for the opportunity you have given us children to speak out. As girls, over 7,000 have been defiled. What causes this? We have been defiled and nothing was said about it. Where are the government? What are they doing to end this? Where are the men who defiled us? I want to call upon the government to, I know in Uganda here we have laws that support the children, but are they working? Are they finding these men who defiled girls? Like in COVID-19, we registered so many girls being defiled. For example, I just sat my PLE recently, and the 2 girls were already pregnant. Nothing was done, but thank God they came back and did their PLE. So I just want to call upon the government to support us girls, to enable that these men are found and they are punished, because we girls deserve justice. Thank you so much for the opportunity, for God and my country.
Wow, thank you very much, Celia. The question is, where are the men? If you're having girls pregnant, who is the impregnator in that context? And where are they at the end of the day? Yes, my dear.
Good afternoon.
Good afternoon.
Thank you for the opportunity. My name is Rebecca Kimali. I'm a student for Natural Primary School. I'm going to talk about how coronavirus affects most students in Uganda. I'm a refugee from Congo. I was here in 2022. It is when COVID-19 started. When it was started, me as a refugee, I did not have anywhere to go. Most of people went in the village because their parents said that it was cheaper. But I was home doing nothing. Most of people got pregnant. Most of them were raped and some dropped out of school. But the good thing is we had a program called Girls Empowering Girls in our school. It supported us with cash transfer, and that money helped us so much. And when I went back to school, it was easier for me because of that money. And now I'm requesting the government to continue to support that program, to put more money. Because we want most of children to go back to school and continue to study. Because education is very important in our life. And I'm thanking all programs which is supporting me and other girls. Thank you.
Thank you very much, Rebecca. I think, yes, while we speak about the children, we have to remember the communities of refugees and also internally displaced persons in the country. Yes, go ahead.
Once again, good afternoon, everybody.
Good afternoon.
My name is Zainab Ali from Kampala Primary School. Another problem the children are facing is violence. At home, children are beaten. They are abused. They call their names, which we don't like. Even our own parents think that to come get married. Why? They just want money. Why? Their only excuse is COVID, telling us COVID has affected them, as if they are the one who have got COVID. Telling us that things are very expensive, go and get married, so that we get prices. My question is it really, are we the problem or not? We children, can we enjoy our own rights? I'm sure that in Uganda has laws, and the laws are misused. Who are those who are misusing the laws? And where are they? They're in the community. They are not arrested. Our girls, our sisters are raped. What are they doing for them? Nothing. The men are just there, doing their own things. And the girls are there suffering.
Okay,
Can the government come up with a problem so that they help those girls who are there outside suffering?
All right, thank you very much, Zainab. Very passionate. Clearly, you're not the problem. That is the truth. You're not the problem. There is a problem with a parent who thinks that because the situation is tough, marrying you off would be the solution. Let's get one of the other children, and then there is a microphone right behind you.
Good afternoon, everyone.
Good afternoon.
I'm by name of Nadia Shakir. I want to talk about education. Many schools are very far because for me, I come from Makere. UP schools are not many in our areas. You walk a very distance to go at school. That can make you say, I'm walking a very distance. Let me stay in the what? In the way. Security. Nowadays, children are very taken by the strangers. Protection, because when you go at the police, they tell you that you pay the money for protection. Those are my ones.
Thank you very much. Here, long distances, the kids are discouraged. I mean, why do I have to walk for that long? What does that mean? Government, when it comes to investing in education, there is a lot more that needs to be done to bridge the gap. The distances don't have to be that long. We'll give it to just about 2 more before we get back to our, yes, I have a hand right there. I'll give it to 2 more. So after her, I have the last person at the back, the gentleman at the back.
Thank you so much. Tumwebaza Eunice, I work with KCCA, Manager Gender, Youth and Children. I think this was very good. I'm glad I came. I've learned a lot. Just to add maybe a request. Someone who presented on education and the 4-term system, I would have loved to know where we are. If it was proposed then, that was 2020. We are now in 2022. What has happened? I know of some parents who moved their children according to where they were supposed to be, and now they've started. They were in P5, 2020, 2022, they were able to do P7. So what is happening? Is that model still working? Just a thought. We have street families in Kampala, and I believe where the cities are coming now. As I listened in throughout, it was like we were addressing children who are in communities, organized communities and families. How about those in Seni? How about those in Katwe? Where you ask a mother, a young mother, really very young, 14 years, and you ask her, who is the father of this baby? And she will tell you, Kawenja is the one responsible. When you ask where is the Kawenja, I last saw him the day he impregnated me. What is happening? And how are we going to manage with the values, the norms, and the culture we're talking about? It beats me, but we are in the middle of it, and it's not about to end. The other thing is, we are getting epidemics. Ebola, COVID. We remember during COVID, the social workers were not taken as the frontline workers. And we've kept away, we stayed at home. Yes, we came and rescued children in street situations. But now, with Ebola, there's something new that has come up. When someone gets infected, goes to the other center where they are kept away. And then when they get ill, they have to come back to the community. And this person, the community is not ready to receive the person. And sometimes they are children. Remember the 2 schools that were affected. How are we handling that process? I would request the ministry, maybe responsible, to come up with a clear referral pathway. How do we handle? Who should be involved? How do we handle issues of psychosocial protection and all that? It's a request from me who is implementing. Thank you so much.
Thank you very much, Eunice Tumwebaze. Very, very key. Yes, the social workers were not considered as, we call them what? Essential, yeah? They were not essential workers, and they had to stay on. Yet all this was actually happening. Let's get our last response before we can get final remarks. You hijacked it, but okay, let's first get the gentleman and then on off with you.
Thank you very much. I'm called to the agenda Garvis from PMDU. When the kids were speaking, when I was learning physics, there's what they call time dilation, where time becomes slow. Me as a man, especially the second speaker from the girl, it was a bit painful, especially when it comes to fighting girls and people are not caught. I think the country should be serious about that. Because if you go to open these children's hearts and you feel what they feel, if you can put yourself in their shoes, it's a very painful moment. So that is at least the preamble of what I'm talking about. The last speaker from the high table talked about many beautiful things that we have, but they are not implemented because of lack of funding. And to me, the interpretation of lack of funding comes from 2 things. One is lack of the funds, which means poverty. The country is not doing well. And the solution to poverty is development. So, instead of making simple programs talking about girls, we should also include development as well. But also the causes that can lead into lack of funding is misuse of the funds. So to me, I think there are two major issues that we should look at, not trying to put only focus on small things when the problems are somewhere else. Lack of development, and also misuse of funds is the biggest issue. But then there is an issue that people have talked about, which is corporal punishment. I find in Africa we have double standards about corporal punishment, because research has shown that corporal punishment is not the right thing to children. But still some other people think that corporal punishment is the right way to go. Why don't we call a proper dialogue supported by science to make one common stand about corporal punishment for children in schools? Thank you.
All right, thank you very much, Mr. Triagenda. And very, very lastly, the lady.
Thank you so much. My name is Agnes Nawachwa. I work with Trailblazers Mentoring Foundation. I would want to comment just on what we are discussing, especially around the resilience for children. I think that if we can have more empowerment programs for the children themselves to speak out and help us understand what they are going through, we can do better for them. I believe that's nothing for us as children without us. So this has been a good platform for them to give their insights into what is happening in their world, and I hope that this informs policy and the next steps. Then I also think in terms of education, we need to complement the formal education. I would like to appreciate that the Ministry of Education has brought the supplementary curriculum for the secondary school learners. But then we have children who are out of school, who need life skills. Because I think that even when we strengthen response and referral systems for the children, if they are not empowered, they will not come out to speak about what is happening in their lives. So I think that if we can give them life skills and still complement them with other economic skills that can help them harness their potential in that regard, they can be able to survive much better and be better citizens. Thank you so much.
All right, thank you very much, Agnes. That's very true. I think there needs to be a lot of hand-holding and mentorship, because the people we consider adults have also probably gone through the very challenges that children are going through, and there needs to be some sort of information sharing and hand-holding that needs to take part. I want to thank all those who are also joining us on Zoom, because this was a hybrid event. This is what COVID-19 taught us. And a special recognition as well for the European Union, which is in the House, a representative for the European Union. Thank you so much for coming through and ensuring that this conversation goes on. I'll give just a bit of a minute each to our panelists to simply wrap up and just add on to probably some of what could have seemed as questions that have come through before Honorable Mateke will be taking up the closing remarks coming through. Let me start in no particular order with Lydia. The issues that you think you will, as the child funders, will be taking up from what has been discussed from both the children and the other members of the audience.
I think one of the members of the audience has talked about discussions on development programs and looking at poverty, addressing poverty. Definitely there are programs that we are currently having, ensuring that we economically empower some of the communities that we are working through. So that is it. We also do a lot of child empowerment programs. I've not talked about them, but we believe that children are the best people to protect themselves, and they are the best people who can actually explain their issues. So we do a lot of that, and we will still do that. I think issues of referral pathway for general emergencies, not only COVID, is also something that we feel we could be able to work together with other stakeholders to be able to address, and also engaging the community in general on issues of violence against children. As you notice, much of the discussion is actually affecting the community members. So we need to put in a lot of effort. And as we've been discussing throughout the morning and up to now, we've talked about the collective effort, because protection of children is not a single initiative. We work closely with the government, but we also need to bring in other stakeholders to help us. So I think those are the issues that we can be able to address. Thank you.
Thank you. Thank you very much, Lydia. Honorable Flavia, as you get back to the Parliamentary Forum on Social Protection, what does this discussion bring to the fore in that regard?
Thank you very much. I want to thank the discussants, my fellow discussants, and the issues that came out of the discussion, especially from the children. And I picked one thing from the people who spoke, although I did not get the name, but someone talked about food as the key. I think it was the guest of honor. Food as the main thing for the children. And we very well know that most of the girls who got pregnant were captured on food. Most of them. It was food, the homes have no food, the children are hungry, and only a chapati, a chindazi were the things on which they were captured. And then they fell into the problem of getting pregnant. And so, I think as legislators, we would like to implore the Prime Minister's office to fast track, actually expedite the food and nutrition policy. And I think it is so long that you promised this policy. It is since 9th Parliament that the OPM promised a food and nutrition policy which is not coming. Or maybe, as the Uganda Parliamentary Forum on Social Protection, we may have to come up with a private member's bill on food and nutrition. Because even the adults are hungry. We sit in those offices and on desktops when we are just hungry. And we are sacrificing for many other pulling things, rents, fees, and so the parents decide to be hungry, and also the children are equally hungry, and that pushes them into ulcers, into luring for things, to make decisions that are not good for them and their future. And secondly, I think it captures my mind that the social workers need to be declared essential workers. Because in this regard, we are talking about social aspects. Yes, they may require financing, but the social aspects require a social worker. Because we have even found that we have rehabilitation centers for PWDs at the age of 16 to 35, but those who are under 16 now go to who? Ministry of Education only waits for them to come on their own to school, but they never go to the villages to find out those who would be in school that are not in school. So the social worker here requires a lot of participation in this, and also facilitation, of course, to ensure that they do that other work that the institutions, the mainstream institutions, cannot do. And of course, lastly, I would like to emphasize that we need a national social protection system that gives a life cycle approach, a humanitarian approach that works with the person from the womb up to the tomb. I thank you.
Wow, thank you so much. That's a lifelong journey. That's very true, and that's a journey we need to be taking. Dr. Munir, I would like to come to you. What's the next step of action as UNICEF after hearing all these stories coming through? I know that you've championed children at the forefront.
Thank you very much. I think it's very clear, as the guest of honor said, she wants to see an action plan coming out of this meeting, and this is what we will work on with our colleagues and partners from OPM, because many good ideas have come across today, and we need to put them into action. And if you allow me just 1 minute, there are two things that I want to comment on.
Please. And
I wish the Honorable Minister, the guest of honor, was here. I do think it's very important that now, as the Honorable Sarah Mateki mentioned, that the President has ordered a cultural audit to see what is good in terms of culture and what is counterproductive and needs to be changed. Corporal punishment is one of those things that we inherited, and they are bad, and they are against human rights and against children's rights. They are violations of children's rights. I am one of those people who suffered a lot from corporal punishment in school. In our days, we were beaten like, not even donkeys would be beaten the way we were beaten. And I don't think that helped us at all. It did not, and that's why I think we need to rethink this cultural practice that we believed it helped some people to grow up in the right way. I believe the violence we are experiencing today in our societies is the result of corporal punishment that was legal at home and in school. It has built in our minds that violence is the way to solve problems. This is wrong. And in a number of countries where I served, here in Africa, in this region, there was a very clear correlation between the teachers being allowed to beat girls and boys in school and the power the same teacher had for the sexual abuse of the children, boys and girls in school. A clear correlation. No, violence is no. And my final remark is that it's really very important for us to understand that it's all about equity. Money is available. Uganda has money. Many African countries have money, but it's the use of the money, I believe, which is the issue. For instance, in many countries in Africa, we say we cannot implement social protection benefits because we as governments don't have money. But we as the same government officials, people like myself, sitting to make decisions about my benefits, in addition to the salary, I will ask for not only pension, I want transport allowance, house allowance, education allowance for myself, while I'm very well paid. But for the very poor person who is underpaid, we think it's luxury to pay that person additional social protection allowances. We allow it for ourselves, but we don't allow it for the poor. It's about equity. Thank you.
A round of applause for Dr. Munir. Very, very true. It's about equity, and like he did mention his experience, I think that it's been said. Funny but true that it is only in education whereby the teachers or the service providers mistreat their clients by beating them and expect them to still be able to come through. But as we get to wind this up, before I invite the person who will get to have Honorable Mateki coming through, I am going to request Mr. Okello, our convener, to come and speak to us for just a few minutes before we get to have Honorable Sebunya to invite, Honorable Kasule, I beg your pardon, to invite our minister to give us a closing remarks, and we'll leave then after.
Thank you very much, our MC and moderator. I want to make a request to you that you give a thumb of hand to our MC. You've made us proud and you've made a day very colorful, but you still have the microphone. Our minister, Honorable Sarah, the country rep of UNICEF, Honorable Flavia, the head Prime Minister's Delivery Unit, and the Child Fund representative here, and all development partners and colleagues. I thought wise that before my head Delivery Unit invites the guest to come and make closing remarks, allow me draw your attention to the following one, that this meeting could not have happened without the following, so allow me to introduce them. I want to invite comrade and my brother, Robert Musoke, come in front here. I want to invite my sister Fiona, who made this thing, come in. And then my colleague, she can just stand, because I don't know if she'll be comfortable to stand, Engineer Brenda Komugisha. As you can see her, I do not want to disturb her from coming this side. Honorable Sarah, this is the team that has made this day.
We had a good plan, and we still have a good plan. We are committed in ensuring that this event will be held twice as per the request from UNICEF. We'll continue organizing this, and next time we'll do better by expanding the forum. Honorable Minister and all participants, due to public demand, personally I will request our MC here to avail us time at her studio for Honorable Sarah Mateke. You already know my story. I think my story, and the country UNICEF, country rep UNICEF know my story. I sympathize and I felt bad. Those who were seated closer to me, I was crying when these girls were making their stories. It's so sad. The question is, where are the men who pregnated us? That we must find the answer to that. So, Honorable Sarah and my head Prime Minister's Delivery Unit, the health thematic area and education thematic area, I want to put them to pressure to deliver on this, working closely with all development partners in ensuring that the politeness of these children in the country is really addressed. The concept of social protection must be addressed. And Honorable Flavia, count me as your foot soldier. Even if Honorable Sebunya closes my door from coming, I'll look for you for us to make this come a reality. Yes, my background, as you will see, if Midwood allows me to come in the TV, I do not want to talk much. Allow me once again to thank another person, Tawanda, for his technical guidance and decisive decision making. Mr. Tawanda, may you please come forward, because we are going to take a group photo. Yeah, this is a team. So with that, our MC, allow me make just two announcements. That lunch will be served down. Do not go without having lunch with us down the restaurant. And then our front desk, they invited the chief guests. You will have a VIP lunch just served across, and I will lead you to your room where you shall have your lunch. Please allow me once again to request that MC to permit us how we shall take a photo with these guys. Thank you so much, and God bless you.
Thank you very much, Mr. Okello. Definitely, there will be a group photo even right after this. And I agree with you that I should have been warned that this was going to be emotional at some point in time. Listening to those girls speak, I was imagining myself in their shoes, that if their future is jeopardized at that point, what will happen? Who will be the next Mildred standing on this microphone here? I think we need to protect the children, definitely. And allow me, ladies and gentlemen, to invite Honorable Robert Kasule Sebunya, who will just speak to us a minute, and invite, of course, our Minister, Honorable Sarah Mateke, to officially close this off. And this team that has made it possible will officially as well join the team at the front to take a group photo. Honorable Sebunya, over to you.
Thank you so much. Because we're pressed for time, I know Honorable Minister wants to rush to Parliament. We at the OPM, at the Prime Minister's office, and most especially the Prime Minister's Delivery Unit, are committed. We have a strong team of education, we have a strong team of health, and we have strong teams like Dr. Okello, infrastructure. We are committed to help you. Our core function is to remove bottlenecks wherever they exist. And I commit that I shall allow my work to my colleagues to interface with all development partners, especially UNICEF. We thank him so much. He has come to my office several times for many issues, and we have solved a few. But we pledge that we shall solve more. And then working with the minister in charge of the youth and children, please, our doors are open. We shall go to her and make sure that we help wherever possible. I will ask my team please don't ashame me. Write a proper report after this. And it shall speak to the budget and it shall speak to the policies that we have. We don't want to waste people's time. We must do things that make a difference. And with those few words, may I help call the minister to give us her closing remarks. I've worked with her before. I didn't think I'll work with her again, but God's mercy is us. She seemed so high up there, but now I'm in the engine trying to operationalize what she does, please. Okay, thank you so much, the minister.
Wherever you feel free, Honorable, is where you can speak from.
Thank you so much. We are still working together. Unless you want to chase me, but we are still together. My colleague, Honorable Flavia Kavahenda, the UNICEF coordinator, my colleague, Honorable Semunya, and even so here, Honorable Najemba. The development partners that are here, officials from OPM and other government MDS, ladies and gentlemen, good afternoon once again. Let me take this opportunity to thank you for being available. It is very, very important that I saw everybody very attentive. I want to thank the panelists and our presenters. What I want to tell you that issues to do with children, that is the topic which is more touching. More touching, and I always tell people that if we do not handle these issues of children now in a better way, we should expect disaster in future. If we handle it very well, then we are sure that we are going to secure the future of our children very well. Because I can imagine when children are growing up, when you go to the cells and you find the children who are there with their mothers. And the other day we decided that all those who have overstayed, because their mothers who don't want to leave their children, we are going to remove them from the prisons because the children are very innocent. Indeed, when one colleague said there are painful moments, I have handled this docket for now close to 2 years. It is the most painful thing when a child comes and tells you, so and so raped me, defiled me, and they reach in court and there is no justice. The men are released and my hands are tied. If we have to make noise, you join me in making noise. As I speak now, just a month ago, someone defiled a girl and disappeared with somebody's child, S2. Later, when there was a lot of noise, this man decided to carry the child somewhere to a clinic here in Kampala. And they carried out an abortion. And I think it was carried out to the person who was not very conversant with what he was doing. And the bladder was injured. This girl stayed in coma, and one of the nurses had the courtesy to get her phone and call anybody that she found in the call list. Said, we are here with so-and-so, she's unconscious. So the father was not in Uganda, he was in Kenya. He came. Reaching there, found the girl. Police carried out its work. This person was arrested after a long struggle. I think it was Honorable Matembe who was behind it. When the person reached court, he was released. This girl is still home, nursing her bladder, and I am scared she may never have a child again in her life. And you have released the man and has gone. So what do we do? When yes, yeah, he's still impregnating others. So as we are talking, there are things which are there and are painful. And I've said we cannot handle it as gender. We need all of you to come on board. If it means making noise, let's join hands. These girls need justice. Where we have a problem is where the girls are impregnated and the parents go and negotiate. I think you've also heard of that. The parents go and negotiate and they want money. So, at times you will never know. You only go to hear someone gave birth and everything is silent. But I pray that where the girls get up to request for justice, whichever officers that are responsible, whether police, whether DPP, whether court, our magistrates, I pray they should imagine, suppose this daughter was his or hers, would she make the same judgment that she's making? I can stop there. We have very many issues, the way they have mentioned, and I pray, I wish this dialogue was for a full day, and we give people opportunity, and we come here with the recommendations. We pray that we shall not stop here. I want to thank the Office of the Prime Minister for organizing this dialogue. Indeed, we needed it, and we still need more time so that we can agree. I have heard everyone is now saying corporal punishment, yes, another one, no. So, we need to agree. But all of us grew up with chiboko, whether you want it or not, and by the way, be beaten by people we don't know. Along the way from school, you make any mistake, you see somebody disciplining you properly. And now the problem, no one will discipline you. You touch somebody's child, the parent is the first to go to police, they have beaten my child. So even if they see your child doing something wrong, no one will touch your child. So at the end of the day, these are the children who are growing up, and you're seeing what is happening. I want to thank UNICEF for always being there for us. We want to thank you for being available for the children of Africa, and in particular the children of Uganda. We want to thank you. We want to thank you and thank you. Let me take this opportunity to officially close our dialogue on recovery and resilience for Children's Dialogue Series. Thank you so much for good and kind.
Thank you very much, Honorable. And yes, we will continue. The recommendations will be taken. And without any further ado, I'll request that we all stand and take the national anthem as stanza each, with the East African starting, then Ugandan anthem in that order as we get to close off this. Ladies and gentlemen, for sparing time, I'm going to ask Mr. Okello and the entire organizing committee to come up here and have this photo moment. I am in that vein not forgetting Mr. Tawanda to come through with them. Madame Doya and Dr. Init as our presenters previously, I'm going to request that we take lunch, as the MC will be joining after calling out the people. And lunch is going to be served right below. Johnny masses to you all. Thank you so much for engaging in discussions that will turn around the future of our children. God bless you all. We'll take it right up here.
I was only saying that the next time on the mailing list we shall have to have police here invited because they are very concerned, the cultural leaders and religious leaders. So they will be part of the list. And also we shall, that time, make sure that the Prime Minister, we shall time her to make sure that she's present. Otherwise she would have gifted these schoolgirls.
After the first picture, I will request that we actually have the children come and join this one.